particularly in rachana subject. So these are the few points I want to add in your discussion, not now, but even in and my best wishes to all of you. In this structure, you will have to also to study hard for uh, the with different teaching methods and the vertical teaching and horizontal teaching. All these things are coming in this, and the lecture to non-lecture ratio is 1:2. So how we can implement it at our institute level is again a important point from education point of view. So my best wishes to this workshop, and over to Joshi sir.
Thank you, sir. Thank you for your uh, overview. Thank you for your comments, opening remarks on this Rachana Shari, as well as a curriculum process. Thank you for your remarks. And now I request uh, President, Board of Ayurveda, Dr. B.S. Prasad, sir, to uh, explain us the overview of this Ayurveda curriculum.
A very good morning to all of you. Dr. Joshi, I am audible?
Yes, sir.
Yes, okay, very good. Honorable Chairman of our Commission, Dr. Jayendraji Pujaraji, all other respected presidents of the various boards of NCISM, and Dr. Joshi, and all the teacher colleagues. It's very pleasure to meet all of you at this occasion. In fact, the new syllabus we wanted to discuss with you and the implementation strategy, how to implement it. I must compliment our chairman for taking up this type of activity. In fact, during the days of the Board of Governors of CCIM, that time itself he started. You can understand his vision and also by his words. Now he spoke about 2030. So he is where he is aiming and where the step is today, whatever we are stepping, this is meant for the 2030. And the maturity and thinking level, we can also understand his level of thinking. So the futuristic ideas has been put forth. In fact, we don't have educational technologists in Ayurveda. All these technologies, we don't to that level, we will not achieve the objective. So ultimately, colleges are going to produce the professionals. So at the college level, we implement at the advanced teaching technology or the global trends, global technologies, global techniques. Our people will not be suitable for the global requirement. So that is a basic idea. So we want to incorporate all the present teaching technologies in our curriculum so that our students will be trained in the present standards, and so these people will be tomorrow suitable for global requirement. So that is the total aim of this one. I must thank Dr. Joshi as he took a lot of pains and his entire team. I don't take the every name of that one. Subject wise, the big group of the teachers involved that one to prepare this type of curriculum. Earlier, there was only syllabus. Very broad outlook was there. Now it is a curriculum. Curriculum is a detailed syllabus will be given. Detailed syllabus are structured. The curriculum or syllabus will be there here. The advantage is here. Every topic has been defined. What is the best method of teaching? What is the way of assessment? Teaching is again then art, or it is a sort of a technical part. It is there. We need to acquire the skills, teaching skills, the teaching learning skills and teaching learning evaluation skills. All is very important to be a good teacher or effective teacher. When you're a good teacher, your students will be very good. They can be good practitioners. There are good professionals. I can say that intermediate practitioners, good professionals. That one. So that is the way how we thought of this entire curriculum, and we framed the syllabus now. The presently curriculum and developed it. And so what is our teacher role? Here there are the new terms has come. For example, program, course, etc. This there is a clearly the instruction manual has been given. They are well specified. All of you go through it and understand what is program, what is the course. These are all very important there. So definitely many times it has a lot of confusion. We have BMS is a course. Now here it is not like BMS is a program. Then first profession is a course, a subject is a course, it going to come there. Likewise, it's going to have different terms have been defined very well in the instruction manual. So all the teachers it is request to go through the thoroughly and read them, understand very well, and then implement the same technique. Don't confusion there. So we what we have to do is we have to unlearn and then relearn. So first what you do is you have to try to forget whatever you already knowing that one, and then forget that one. Make your brains free totally, just like a empty CD, which is a fresh CD. Likewise, then relearn with the new content there. Then only, otherwise it will be a lot of problems comes there. Here superseding and a lot of confusion comes there. So try to unlearn and then relearn. So then we have very perfectly this can be understood and you can be able to do that one. And next challenge comes you to implement the newer technologies. Some of you already been trained on these new teaching methods there. Only some teachers are newly recruited. They may be new for that one. And this is the reason we made a orientation program this one now. So you will be having enough time to interact with the teachers who prepare the curriculum, and you can get the ideas how it can be implemented there. Again, this interactive session may give examples only. In the just like a Bible, you must do the same thing only. Content, everything is fixed, but the way of teaching, the examples, the activity what you go to take it up, that may have you have your innovation can be done there. There's nothing, there's no minimization there. A teacher expert can give you an example, but you can have 10 types of examples. You can innovate that. These are at your area, you can do that. This is what actually expected from you people. Try to understand the theme or the basic idea or the theme of the topic and the methodology, and then you will develop your own way and with good examples, lively. And here we have made theory to or a lecture to non-lecture hours 1:2 ratio. Earlier, practical hours are 2, 3 hours. For example, maybe in a day of 6 to 7 hours of the timetable, there is only 2 hours of theory, practical will be there, and rest 5 to 4 hours will be theory will be there. Now we may reverse that one. Here there is 1 hour of theory is there, 2 hours of practicals will be there here. Practicals are any activity-based learning. That way we made as non-lecture hours. There is no lecture here. Some activity. It can be a group activity or edutainment. It is a new things, edutainment, entertainment plus education. The students can play and learn. Then we have to encourage them. That will be very lively. They won't forget also. So it will not be stress-free when you have they are playing together and you have their learning also. We have to make the environment a joyful environment, not very serious environment there. We have discipline, but we should have a joyful environment. Student has to be in a comfortable way. They're able to study and they have to enjoy that education, not a stressful education. We have to be that way we made it as edutainment. This is a new edition we have given like this. Role play. They will enact and learn it. They won't forget it. Not simply sitting there and going on hearing the lectures. For example, somebody teaches how to ride the cycle, and he can give every step of the cycling. He will theoretically will explain, but student cannot ride the cycle unless he practice that one. So we need to have more of hands-on training, experiential learning. They must do experience. They must experience it. So that is the reason we made it to 1:2 ratio. So you people try to give enough opportunity. Try to think of innovation. You do it, and then make the people lively. The classroom. They have to run to the classroom, not running away of the classroom. They will be interested. So today I will be have this one, that one, like they'll be having interest. They should not run away the class. They should run into the class. That way you have to make the environment a conducive environment, academic environment, joyful environment, learning environment will be have to make that one. And another major aspect apart from the teaching and the learning, the assessment part. Here also we have to give a lot of the thinking has to be given. We have to have good planning before we go conduct examination. Yeah, I have also seen. I'm also a teacher. I was a teacher. Then I'm the as principal. I was seen the many years. I saw how the exams are conducted. So many times what happens, we are very casual. We give a cheat. Sometimes you write about this. You give a one keep some item there. You do it, and then people going and writing. Then what is the meaning of theory and practical? Practical means we have to assess the skills there, the practical skills, practical ability, not just writing again. She gives the chit, you write about the humerus bone or from the femur bone, etc. So it is of meaningless. Either theory you ask it or you give the chit there, there is no meaning there. So now in the practical also, especially anatomy, is again very important subject is there. So we need to think of how to assess the exact skill what we are expected from the student to be learned that one. And especially anatomy teachings, it is of we should not think of true anatomists there. though you are MD anatomy, but think of the clinical point of view. What a graduate is required to learn for his clinical practice. Ultimately, we are making the BM's graduate degree as a clinical practice, or practitioner we want to produce, a clinician we want to produce at the UG level. PG level, we have specialists that may be going different lines, maybe researcher, teacher, whatever it may be there. But UG level, we want to produce only clinicians there. So you need to understand what is the extent of anatomy to be taught for the becoming general practitioner there. So in that aspect only try to do it. And again, your anatomy is going to supplement the surgery cellular subject and Shalaka subject or clinical practice cells. So when they go to clinics there. So in that angle, you have to think always clinical anatomy is most important there. Not directly going to the true anatomy of this one. For example, maybe in the muscles or so soul or arch, palmar arch, plantar arch, etc. So there are so many things are there which may not be relevant to them. If BMS or clinical practice there. So they are not going to be physiotherapists also. They are not going to be orthopedic surgeons also. Likewise, we need to think of the role they have, what they're going to do it. So you need to modify your anatomic content and way of presentation in that angle, a clinical point of view angle also. So these are the few of things which we need to think of at this level, and then subject wise they are going to tell you which content, how to deal, how to wait. We have bifurcated the content into first term, second term, third term, 6 months, 6 months, 6 months, very clearly defined, so that we don't have overburden, we don't have less content also. Exactly which content to be taught when, so that we have enough time for the subject can be given there, enough methodology. So then when exams to be planned, enough time has been given for examinations. We have to plan well for the practical examination. It should be truly skill assessment only, not a theoretical examinations once again there. And so again, teaching should be in the clinical point of view, and then activity-based learning, more and more activity-based learning. These are the few things which I want to convey at this juncture. And then question paper also. We need to touch important aspects. So we have made a blueprint of the question paper. So which aspect we want more to study by the students, must to know. So there we have picked up more this one. Nice to know, desirable to know, we have less weightage was given there. So this we have to understand now. Earlier there was a classification, but the weightage was not given. Now we have taken care to give enough weightage for the important content which the student must to know. So that way we have taken care of that also. So these are the few aspects in the overall the curriculum. And I must once again thank our chairman also for his insight, and the Dr. Joshi, who has taken very, very keen interest in shaping the syllabus curriculum into this content, and the teachers who are all involved in that one, they have done a very great job. And those teachers going to be orient you, and you can have free interaction and try to maintain the discipline there. Don't unnecessarily everybody going on shouting in that one. Only one student, one staff member can unmute, question it, and then get the answer for it. You will everybody will get chance there, enough time is there, and one same question don't repeat it, and try to get the newer insights. We may set up the implementation committee team also, and later on if all any time problem comes here, you can have the corresponding the system can be we develop it shortly, and then you can have the link between the team and you people also can be continued that one. That way, once again I wish all the teachers for coming to joining this program, and also I request you to keenly hear the experts and try to interact with them with the discipline, and try to learn the objectivity and implement it, and come with the implementation with the experiential feedback. We want that one, so that will be real feedback. Once you experience, when you teach that one, then you know what is the problem there. That feedback we want, then we can modify that one. With this, once again I thank everyone. And Joshi, you can continue.
Thank you, sir. Thank you. I'll just sum up in a minute that we are very blessed and fortunate to have a chairman like Dr. Jayant Devpujari, sir, who understands this concept of curriculum reforms. And he started all this with a survey. Actually, it is the basic. Whenever the curriculum is reformed, there should be a survey, and stakeholders' opinion are most important. So that way, a nationwide survey was conducted by sir as a chairman of Board of Governor, and he came with a idea and the theme that this curriculum should be reformed. Based on that, with his vision, he has given, and that we can see in the form of MSc that is published. The structure of the course is also changed to 1.5 years. That was the demand from most of the stakeholders like students and teachers and even the industry, that the appropriate time for the actualization of the concept is more important in 1.5 years, that we can get in 1.5 years. So thank you, sir, and thank you for sharing your views. Then we have, after the NCISM, as NCISM started, we have this Dr. Prasad as president of board of Ayurveda, and this is a major advantage that he knows the insight. He has a very in-depth insight of this educational reforms, and he has worked and he has transformed many of his ideas in the education technology in real practice as a principal. So he is our guiding force. So thank you, Chairman sir, and thank you, President sir, for enlightening us with these thoughts. Sir, should we start the further program? And then Dr. Preeti Desai ma'am will join to explain or elaborate on the actual methods, teaching learning methods and interactive methods, those are involved and how to implement them. And then Dr. Gaurav Savarkar, he will address the assessment part of this curriculum. So I am sure that all the faculties must have gone through the user manual as well as the curriculum files. So if you have any problem, then you can ask at the end of the session. So at the end of the session, there will be a discussion session, and then there we can discuss, as sir suggested, your views, your ideas, your concepts are almost welcome, and we will inform all your concerns and the questions to President sir. So this is the tagline which is selected: Shastram Jyoti Prakashartham Darshanam Buddhiratmanaha. So this is an apt tagline suggested by sir, and that is chosen as a tagline for this curriculum process. So we are here, and our vision is more important to explore and understand the concept which are given in this manual. So when the NCISM, as per the NCISM Act that came in existence in 2020, these are the objectives. I'm sure everybody must have visited the website of NCISM. Here, the basic purpose of this curriculum is to produce the Ayurveda graduates. And first of all, we have to understand and know what are the roles of the Ayurveda graduates. So probably, based on that, the minimum standards of education are set by the council, and then it comes the curriculum. So curriculum is appropriate, curriculum is required to strengthen our graduates to work and play various roles in the society. So currently, producing the clinicians as a UG level, producing the clinicians is the most important target. Then there will be academicians also. Some of them will go in the pharma industries or any other industries. Research is again a core area where we want everyone to participate as a graduate, and there are many other occupations and opportunities that are available. So our role while developing the curriculum was to take care of all the needs as a graduate should know. So this was the outcome-based curriculum structure that is adopted currently. So we have designed Council has designed these graduate attributes based on that program outcomes. So as explained by sir, Ayurveda or BAMS is our program. So the concept was initially used for course, but now we are using it for program. So this is a program, and there will be 3 phases: phase 1, phase 2, phase 3, first year, second year, and third year. So preclinical, paraclinical, and clinical phases. And in these phases, there will be courses. So whatever we were calling as subject, we will now call them as course. So course outcome will be there. So total graduate attributes are the qualities. The qualities that we expect in a graduate after the completion of the graduation, they have to be aligned with the program outcomes. So whatever program outcomes that we are designing, they should be same. So there are equal number of graduate attributes and program outcomes that we are going to see. And for each course, a certain outcome is designed, a certain outcomes that will help us, that will help the student to understand that this is what he will able to learn or able to gain after the completion of the that particular course. And based on that, that course is designed in various topic points, and for those all topic points there are learning objectives, they are designed. So we are going to see the actual manual in depth with the help of this. I request, please do not scribble on the screen. Okay, so graduate attributes. Graduate attributes, we have seen the qualities and features or characteristics of the graduate. So basically they are divided in knowledge, skills, attitude, or values. So when we revisit our samhitas, Charak Samhita, Sushrut Samhita, Ashtang Hridaya, we can find many qualities as a graduate or qualities of Vaidya, they are defined. So when we compile all of them, they are many, they are more than 100 qualities that are explained in our Samhitas that actually Samhitas expect in a Vaidya or in a graduate, we can say. So based on that, committee has collected these graduate attributes, and these will be our graduate attributes that are expected after completion of the program. I'll just go through. They are explained here in Sanskrit as well as translations. So I will go through the Sanskrit part. Swasthaturayoho krute hetulinga aushadhatmakasya trisutrasya ayurvedasya jnata विविध गुरु शास्त्र सेवनादि पर्यवदातता विशुद्धता ज्ञानवता बहुशो दृष्टकर्मता च. थर्ड, प्रकृति वितर्क युक्ति प्रतिपत्तिवित. फोर्थ, कर्म कुशल जित हस्ता च. फिफ्थ, विज्ञाता शासिता योक्ता चिकित्सा प्रावृता प्राणाभिसर वैद्य. Sixth, Daksha, Shuchi, Sadvruttashila, Karunavancha Bhutva, Vartit. So in bracket, it is explained as the expected thing after completion, and these are the qualities. So there is a bracket to separate this. Last, seventh is Satatadhyayana Paraha, continuous learner. The one who will keep on learning. So self-directed learner is the nearest translation. Sushtu Sambhashana Kshamaha, communication as the most important skill that is required. And last, Chikitsaka, Anveshaka, Adhyapaka Gunanam Jnata Abhikankshana cha. The professional who knows the qualities and want to gain them or be aspirant to gain them. So these are the Chikitsaka, clinician, researcher, and the academician. So all the aspects that we discussed in the initial idea, that what are the roles that a graduate needs to play, based on that from our samhitas these are collected. And similarly there are program outcomes, so you can match this Swasthaturiyoho krute hetulinga aushadmakasya trisutrasya ayurvedasya jnata. So based on that, this program outcome is demonstrate comprehensive knowledge and application of three sutra concept and explore root causes, identify clinical manifestations of the disease, and treat matched outcomes. So based on that, these are the 12 matched outcomes, 9 matched outcomes appropriately given for each. So we have seen the last one, that Chikitsaka, Adhyapaka, Anveshaka Gunanam Abhikankshana. So similarly demonstrate an understanding and qualities of the required skills as a practitioner, researcher, academician, and aspires to become one. So they are matched. So you can see these are matched. Again, further going to the manual, this part will help you know and understand all the aspects of a curricular file, those are given. First time with the initiative of Sir, QR codes have been developed. So on the first page, you can see a tagline, then logo and subject name and a QR code. You can download that in your mobile. These files are specially designed e-files. Those could be accessed on any of the platforms, and they have a better visibility throughout the medias. So first page of any curriculum file will be summary. So knowing something at a glance is the most important factor. So at a glance view of the summary file is given. You can see on the right side. This is a summary file. There will be two tables. They will explain first how many papers and what is the distribution of lecture and non-lecture hours, practical hours. And second part will explain the overall paper 1, paper 2, theory marks, practical marks, and viva. And for 3 subjects, we have electives. So marks for the electives and total marks, they are explained here. Some of the terms which are very much important, like curriculum. So we were talking about syllabus. Now we are talking about the curriculum. So curriculum is the from beginning to the end, everything, every aspect of it is covered in this. In the syllabus, it is just a list of topic. It was just a list of topic, but now it has taken a complete curriculum aspect. So all the factors related from the graduate attributes to final assessment, types of assessment, everything is explained in this. Graduate attributes we have seen, program learning outcomes that we have seen. So in first BAMS, these are actually the courses that we have seen: Sanskrit and Ayurveda Itihas, Padarth Vigyan, Kriya Sharir, Rachana Sharir, and Sanhita Dhyan. So now we have these codes which are assigned to each subject or course, and they will be used for the reference in the throughout the document and everywhere up till the in this curriculum file. So we have seen the basic concepts, that what is the course, what is the program, what is the graduate attribute, and then the course learning outcomes. So first table for every curricular file is course learning outcome. There are few outcomes. They may be 6, 7, 8 outcomes listed, which a student, I just want to interrupt for a while. See, don't scribble on the screen. Those who are scribbling, their names are coming here. So please don't scribble on the screen. Okay, now I have cleared all drawing, but please don't scribble on the screen. So course learning outcome, program learning outcomes. So we have seen the program learning outcomes. They are 9. So they are matched with these course learning outcomes. So going back to our part, these first graduate attributes, then program outcomes, and then course learning outcomes, they are matched to each other. So this is course outcomes, and for each course outcomes, there will be second table. When we go to second table, we will find that there is a list of topic. The previous kind of syllabus we can find in list of topics, but the advantage of table 2 is a clear demarcation of term, in which term that topic will be taught, how much marks or the weightage of the marks in the theory examination is indicated here, and how it will be taught in lecture hours and non-lecture hours. As sir said, we have this changed ratio as 1:2 from the council, that 1 lecture followed by the 2 non-lecture activities. So based on that, we have to take care, and it is explained. Again, there are chances that few of the topics may require the additional time or the less time. That calculation the teachers can keep, and they can inform to President sir after the completion of the first batch. So going through this second table, A2 is the list of topic, B2 term-wise classification, C2 marks-wise classification, lecture hours and non-lecture hours. So since when this is published, lecture hours, we are very much familiar that we are conducting the lectures. Initially, they were only lectures, but now we are doing it online or with the help of, even in the classroom, with the help of audio visual aids. So we are expecting here the interactive lectures, not just didactic lectures. There should be some kind of interactivity added in these lectures. So as we know that retention span of the student is very less, so not more than 40 minutes, that too very high. But when we keep on adding the interactive activities during the class in the classroom, then after 15-20 minutes, if we add a short activity, then we can increase the attention span of the student, and there will be more retention of the contents as a outcome. So we have to take care about the lectures also. They should be engaging, they should be interactive. There are few methods which are enlisted in your curricular file, as well as will be explained today. They can be helpful for engaging the student and bringing out the more interactivity in the class. Some of the activities that sir has explained, like edutainment, giving the entertaining approach. So entertaining is entertaining is something that everyone love. But when we add it in the education, we can see the students will really enjoy and will memorize these concepts for the longer duration. Non-lecture hours is a specific entity added here with the concept that when we read, learn, look, see, so this is a very familiar thing how we learn. By reading 10%, listening 20, looking and seeing 30, then seeing and hearing 50, and so much with the activities, more than 80% retention. So by doing, learning by doing is the concept. There may be the discussions, there may be the interactions, there may be the various other things that we can provide as a learning experience to the students in the classroom, or giving them various activities within the premises, or maybe some outreach programs of the activities based on the need of the objectives of the curriculum or that particular point. So they can be included in the learning activities. It is difficult to include all the possible learning non-lecture activities in the manual or in any of the curricular document. So when we go across Sanskrit, then Padartha Vignan, based on the need of that topic, we can find the various activities. They are indicative. But even a further addition of activities based on the principles of education technology can be useful. So these are some of the activities that you can see, and many of them can be used. So purpose of the non-lecture activities is basically increasing the attention span, and this is again the same kind of thing. Doing it, various types of learners we have. Some are auditory learners, visual learners, and some are kinesthetic learners. So those who listen and remember, those who see and remember, those who when they do, then and then they will remember. So based on these is the chart. Similar kind of pyramids and charts we can see in the various books and various study materials of education technology. So the concept of health sciences education technology, most of us are aware, but we have to recall and apply here while teaching in the classroom. So third table is the learning objective table. You can see a very descriptive table where A3 is the course outcomes. So we have seen in the above table, first table, course outcomes. So each topic and each objective here, each topic and each objective here is matched with this course outcome. So you can just correlate. So wherever the learning objective is there, appropriate course outcome is indicated. So B column will give you the idea of course objectives. So for 1 point, there may be more than one, sometimes 2, sometimes 5, sometimes 10 learning objectives. For each learning objective indicated in B3, in C3, a specific domain is explained. So when we go ahead and try to find about the domains, so we basically know that there are 3 domains: cognitive, psychomotor, and affective, and there are levels of the domain. So when you see here C3 domain as well as the subdomain that is explained, based on that we have to decide what should be the depth of the explanation. We cannot explain in a similar way to an undergraduate student, second year student, and a final year student or a MD student. So based on that, appropriate level, appropriate expectations they are indicated in this B3. Based on that, the domain is indicated. Sometimes more than one domain is also indicated. There we have to see there may be the two verbs indicated, and based on that we have to consider that which is the appropriate verb explained for which kind of domain, and we have to try to fulfill that particular learning objectives. So in D3, the structure of must know, nice to know, and desirable to know. So the first contradiction to this understanding is there is nothing like must know, nice to know, and desirable to know. But when we consider the learner, when we consider the understanding, when we consider the time that we have in our hands, when we consider various other factors, we have to decide that whether this particular topic is must know, nice to know, or desirable to know for that student. Again, we have various types of learners. Some of them are excellent, or some of them are very intelligent, some of them are intermediate, and some of them are average learners. So we have to consider Trivida Shishya Buddhi. So we have to consider for everyone something should be there. So must know part is common for all. Desirable to know, some 10-20% part which is some student can achieve, and nice to know part is still there, where we don't want everybody to know that, and that part is particularly indicated here. This will reflect again in the table 6, and this will reflect in table 6H, where we have to decide while framing the question paper, theory question paper, that must know, nice to know, and desirable to know. There is a specific ratio explained. We are going to see that for MCQ it is 15, 3, and 2. So 15 questions out of 20, 15 on must know, 3 on desirable to know, and 2 on nice to know. And similarly for SAQ, only 1 on desirable to know and remaining on must know. And for LAQ, nothing on nice to know and desirable to know, everything from must know. So that way these points will reflect in the appropriate further columns. So the reflection of this we can find in the next point. So going ahead with this, please don't scribble. Once again, I'm requesting, please don't scribble. Okay. So going ahead, next, the level that know how, shows how, and does. So these are the levels explained in the pyramid. They are to be followed, and they are to be. So Miller's pyramid is a well known for the assessment of these competencies. So based on the Miller's pyramid, these levels are explained here. So they are appropriate. They are matched with the domain. They are matched with the must know, nice to know, desirable to know. So something that we want him or student to just for the cognitive, like recall, understanding, there it may be no. Whenever we have the higher and higher cognitive domain, then it can be show how, and something that can be reproduced, but it is cognitive part only can be explained with the help of shows how, like recitation. That is sometimes these 3 levels are explained. That is rarely required for the first year, but for some part it is kept, and some part we can find does level also indicated. So TL methods, various kinds of TL methods explain as per the requirement of the subject. So in all topic wise presentation, they will be highlighted. Some of them are given here, like lecture method, discussions, inquiry based learning, problem based learning, case based learning, project based learning, team based learning, flipped classroom, very important. Sometimes we are doing this on a regular basis, sharing the presentation and then actually using the classroom time for more activities or more discussion. So discussion always helps student to bring new ideas, generate new ideas, or again stabilize the concept. Blended learning, so using various technologies in the learning. Edutainment approach, early clinical exposure for most of the cases, starting the early clinical exposure from the first year. So this point is well taken as a vision from the sir. And for every year, first year, all the subjects or all the departments, they should try to teach clinically. So for Kriya Shari, Rachana Shari, even for other sciences, we have to think this in mind. Role plays, self-directed learning, problem-based learning, these are some of the activities that we are going to see in the particular subject and preferred activities for that subject. Assessment, again, various kinds of, basically two types of assessment: formative assessment and summative assessment. Formative assessment will help student, we can give the feedback, so it will be more useful for students to develop based on that formative assessment. And summative is ultimately conclusive assessment, that is also explained. So for today, Gaurav sir will do this assessment part. And these are the tables. Table 4 indicates practicals. So in third table we have seen the description of the theory part. In the fourth table, a similar kind of explanation of practical part in the similar kind of table we can find. So after the formative and summative assessment, there comes two more terms: term wise classification, whatever we have seen in the table 2, that is reflected again here, and integrative teaching or integration. So we can have an integration like horizontal integration amongst our first year subjects, or vertical integration. So these activities will actually share time, and these are, when we share time, we can give more output in the lesser time. So considering this mind, the flexibility of the timetable is most important for this kind of platform. So rigid timetable or rigid structured timetable for throughout the year, this concept can be modified with the help of flexi or dynamic timetable, based on the needs or based on the curricular requirements, based on that particular month or a week or a day, or even a department holding different activities in a particular day. So this kind of attempt will actually help us to teach in a even more conclusive way. So non-lecture activities, whatever indicated in table 3 and table 4, they are enlisted here. They are again, few of them are indicated here, others are indicated in table 3, and some of them are again explained in the table 6D. So we can have these activities. 6A, this is the overall structure: how many theory papers, how many, about the assessment, how many theory papers, how many marks, viva, then electives, internal assessment. So here comes the internal assessment for two subjects, Sanskrit and Sahita Adhyan. We have 15 marks internal assessment. For remaining three subjects, it's a 30 marks internal assessment. And for Sahita Adhyan, Padartha Vigyan and Sahita Adhyan, we have 3 elective marks that will be directly added. So there is a separate team or separate arrangement for these elective courses from the council. They will be held online on the dedicated platform suggested, which will be done by NCISM, and student will appear and student will get the certificate. So this was a major query raised, but regular teacher, we have to focus on lecture and non-lecture activities, and not on these electives. So this is a entirely different thing. Scheme of assessment. So per term we have to take 3 periodic assessment. So periodic assessment is a just a activity, assessment activity, which is a formative assessment, which will be conducted within the class, within with the help of particular theme, one topic, two topic, and just to complete this activity for 15 marks. And based on that, how to calculate the internal assessment is explained in table 6C. So 3 internal assessment for 15 marks average. For term test that we are regularly conducting, first term, second term, we have to conduct all the kind of examinations which are as per the university, like 100 marks theory exam, and if applicable for the subject, 100 marks practical examination. The both marks should be added and then converted to 15 marks, and can be written here. And based on this table can be generated to get the 15 marks as the exact outcome, which will be informed to the university. So it may be 15 and 30. Calculation method which are required, they are explained here. Then evaluation method of periodic assessment, this table column G3, it explains the various assessment methods. Otherwise, few more assessment methods are explained in your curriculum file that can be used. So question paper, structured paper will be structured approach is there. MCQ, they are reintroduced. Short term questions, short answer questions, 8 will be there for 5 marks each, so 40, and LAQ 4, 10 marks each, 40. So overall 100 marks paper will be there. It may be there may be one paper or two paper as per the need of the subject. So distribution of MCQ, SAQ, LAQ. So for particular subject or particular topic, can we ask the MCQ, SAQ, or LAQ? It is indicated. So we have to refer this table 6F before drafting the question paper for the internal as well as the university examinations. So this is the blueprint, the 20 questions from which topic they will come. It is indicated here. You can see only topic, but whenever in your curriculum file, you can see this one more. There is one more addition for this Rachana Sharir, which Dr. Gaurav will explain, as we have the questions from various topics of Ayurveda explanation as well as the modern explanation, anatomical explanation. Their questions are clubbed. Based on that, it is called as theme, and the theme-wise explanation, Dr. Gaurav will elaborate. So after the blueprinting, it is explained that out of 20, 15 MCQs must know, 3 desirable to know, and 2 will be from nice to know. Similarly, 7 from must know, and 1 question of SAQ from nice desirable to know, nothing from nice to know, and all 4 from must know. It is clearly indicated. So distribution of practical examinations, that is also clearly indicated. For some of the subjects, Viva. So conducting a Viva, a detailed explanation is there. For Rachana Shari spot, what kind of spots, what kind of problem-based questions, they are also explained. Dr. Gaurav will help. So implementation, based on this selection of, so what we have to do, we have to follow this and implement. So visit the table 2, find the topic we want to teach, visit the table 3, think about the objective. If you want to increase the objective, you can increase your objectives also. Find the appropriate method, and based on that, compile the resources, prepare your audiovisual aids or PPTs or charts, whatever you want to do. And based on that, this is a demo learning lesson plan which is given, which will help us write down the things and arrange the things. So whenever we plan, whenever we appropriately collect the resources, then we can conduct these activities, especially the non-lecture activities, in an appropriate manner. So based on that, you can see these are the contributors. You can find them in the file. And again, the QR codes to download the this curriculum file, they are also given. So this was the brief introduction or brief explanation, with the expectation that everybody will try to implement this in an appropriate manner, and will provide the inputs for the further reforms to council. So thank you. We will take questions at the end of the session. So I request Dr. Preeti Desai to continue with her presentation. Dr. Preeti Desai. Hello.
Actually, ma'am, disconnected. I think I called her. Just a minute.
Okay. So who is sharing the screen?
Actually, ma'am, sharing the screen.
Okay.
Just I called. Yes, ma'am, join.
Okay. Dr. Preeti? Dr. Preeti Desai, ma'am?
Ma'am, please unmute. Desai, ma'am.
You are able to hear me now?
Yes,
Am I
madam.
audible?
Yes, madam. We can't see your screen,
Just
but
a
can hear
minute.
you.
Yeah, just a minute.
Yes, it is
Is the
visible.
screen visible now?
Yes, it is visible. Can you make just full screen?
Yeah, I'll just full screen it. Just a minute. Sir. Is it okay now?
Not reflected
No,
yet.
it is a screen sharing is paused. It is looking. Can you see my screen, sir?
Yes, yes. Continue, ma'am.
Is it okay? Fine.
It's not
Thank you.
full screen, but you can continue.
I'm trying to do it, but I think it would be visible.
Okay,
Right?
ma'am. Go ahead.
Okay. So a very good afternoon. It's just time to be noon. So good noon to all. And before I start with it, I just would like to record my sense of gratitude to the Curriculum Reform Committee for just inculcating in medical education as a part of facilitators in the curriculum team. And again, record gratitude to our honorable chairman, sir, and that's my special
Hello. Ma'am, your voice is breaking. Joshi, sir.
Okay, I can see
I
ma'am
think
got
I think there is
disconnected.
a connectivity issue. Can I share my PPT?
Uh, yes, sir. But can you just call ma'am? It should be in sequence actually.
Yes, yes. Okay, I call.
Just wait. We are trying to connect with ma'am.
पुन्हा हे करते 1 मिनिट नाही तर तू शेअर कर स्क्रीन आता दिसते का बघ दिसते स्क्रीन दिसते Can you see the screen?
Yes. Screen is visible and even the full screen mode is also activated
Okay,
now.
fine.
I think just you have to go one or two slides back.
Okay, sir.
We can see non-didactic teaching method.
Yeah. Not moving, I think. Some issue. Is it okay, sir?
Yes,
Moving?
it is. Yes,
Fine.
moving, and first slide
Fine.
we can see.
Yeah, this slide is already been explained by you, sir. So I would just like to focus on this.
Ma'am, if you have a double login, can you just mute one?
Yeah, I'm going. I was unable to connect there, so I just logged in from another one. I just disconnect that one. Just give me a moment, and I log in. Is it okay, sir? So just we were on. I'll be focusing on teaching learning methods. So coming into the previous curriculum versus new curriculum. Am I audible? Hello.
Yes, ma'am. Yes, ma'am. Go ahead.
Fine. I am a little bit apprehensive about the technical because of the network problem.
Ma'am, I will call. If anything happens, I will call. Continue.
Okay, fine. So just coming to the previous curriculum versus new curriculum, Dr. Prasad sir has already elaborated on this aspects. In a nutshell, I would just like to give it a small overview on it. That is, previous curriculum, it was more on reliance on memorization rather than problem solving. We had more often thought of lecture methods, that is taking up the theory lectures were more, and now, as exactly said, the ratio has been changed from 1:2, that is from didactic to non-didactic lecture. And the previous methods were more of teacher centric approach there, which resulted into passive learning. The students were not actively involved into it. But now the new curriculum, it has incorporation of problem solving methods, developing higher cognitive ability, like as sir has said, we have involved all the 5 levels of uh, cognitive domain and psychomotor domain into the syllabus, and just giving a more chance to the student, making it more student-centric approach and making students an active learner. In the previous one, it was teacher dominant, but now here it is student dominant. It will be more of student-centric. So this is the more focus, because we all are aware about the lecture methods. We all are into it since years, and as a part of traditional and conventional teaching, we all know about the lecture methods. We have learned about how the lectures can be improved, and we are very well versed with it. But these non-teaching didactic teaching methods, we might face problem, because it's little bit of, there are some terminologies which are really very new to many of us. So I hope that this presentation will give you an overview of and just orientation towards how these teaching methods can be implemented into our day-to-day learning activities of Rachana Sharik. So this table already sir had shared, and we have the value, number of activities, the hours which are also given to us. And so these are total 80 hours, and included that will also add up to the practical 240 hours. So it's the 1:2 ratio it has been looked upon. Now coming to there are so many methods like seminar, workshop, tutorial, group discussion, problem-based learning, then integrated teaching, early clinical exposure, case or a case-based learning, self-directed learning, summary writing, field visits, and many more are also given in a manual also. So we'll just discuss it in one by one, and I'll just give an idea about how these can be adopted in teaching of Rachana Sharik. Now coming to the seminar or workshops, like seminars, we are very well versed with both these terms, seminars and workshops. Now seminars, as we conduct, it is most when we have a discussion on a topic in a depth under the guidance of an expert. So here most often the seminars where we conduct, it is a sort where experts or some person with expertise on a particular subject are being called upon, and a topic is being discussed at length with number of questions and answers. But here, this new approach which we can involve is students group seminar, and that under the guidance of the faculty. This seminar, student seminar, you can have you have to pre-decide it. Consider the level of the learners of the students. Like in 12th standard, many of our topics, they are little bit, the students are oriented to it, like fertilization, the digestive system. So modern basics, they are being taught about, being learned by the students in their 12th standards. So considering their pre-existing knowledge or the prior knowledge, you can give the topics for these two seminars, and we can even form a group of students who will contribute to the presentation, and one of the students can present, or from that group can present it. So any of the topics which the students are comfortable, because first year they are very novice. So by allotting the topics, this needs to be taken into consideration. It is very important because you can't just give a topic of Ayurveda, Ayurveda Rachana Shari to them, because it will be totally new to them. The prior existing knowledge or the pre-existing knowledge has to be taken into consideration while allotting a seminar. Okay, and then you can have a checklist also for the seminar as an assessment tool. The students can even mark whether they have been, the objectives of the seminar needs to be decided first, and whether the objectives are being fulfilled or not. So you can have other faculties from the department as facilitators over there, and they can even be the judge, or they can look as an assessor whether the objectives of the department for giving that particular seminar were fulfilled or not. Then second comes a workshop. So when we conduct the workshops, like conducting it for very UG students, we mostly have our workshops like for the dissection workshops and all. But these will not be exactly meant for the first year students. Considering the first year students, we can just design a model making workshops. We can give them the assignments or for model making, coloring of bones, specimen mounting. So this will help in active involvement of the students. This will be where they can perform their skills, they can show their skills, and rather than rote learning and only involving into the theoretical activities, the students will be very well involved in learning the things practically, like while coloring the bones or coloring the muscles, they'll be able to reiterate on what they have learned in the theory. If they're just coloring the muscles origin and the insertion of the muscles on the particular bones, it will help them to reiterate the knowledge. They will be able to memorize the things much more, and when they have done it themselves, it will be the retention of knowledge will also be more. So even specimen mounting can be done. So these are the few areas where we can have workshops. I have seen in many of the colleges they are using very different materials. You can use the wires, you can use cloths, and they are preparing beautiful models. I have seen in many colleges. So it's again depends on the creativity of the faculty members how they can just go into it. So this was just an example. You can just more add to it as per the convenience and the availability in the infrastructure of your particular institute. Now coming to the tutorial or group discussion. Basically, these are small group methods, small group teaching methods, tutorial and small group discussion both. So first coming to this tutorial, it is a small group of learners where they're guided by a teacher to understand the matter well. And when we talk about tutorials, exactly it is tutorial which comes from the word tuitions, that is again reiterating or just reinforcement of the knowledge. So here where specifically the topics with higher level of difficulty can be taken for the tutorials, where there is some doubt in the minds of the students, it needs more understanding. So these types of topics you have to search and take for the tutorials. Here I already said it is a small group teaching method where 15 to 20 students mostly can be there. So depending on the infrastructure, again, you will need some sitting places and all that. Coming to implementation, it becomes little bit difficult, but yes, it should 60 or 100. You can divide it into 25 also. And only the topics of these tutorials has to be selected on a very prior basis. They have to be pre-informed to the students, pre-informed to the faculty. Basically, the method is that it has to be when we prepare a weekly timetable or a monthly timetable. So months, in that particular month, how many tutorials you are going to conduct, those topics should be displayed on your notice board so that the students will get time, the teachers will get time to look into the questions, look into the depth of that particular topic, and that will really enrich or give a pure sense what is the essence of tutorial can be conveyed if these are conducted in a particular manner. So only important thing is selecting the topic for the tutorials and conducted in a particular way. Again, you need to have an interaction with there. So a few examples which can be taken is like concept of srotis, which is little bit srotis. We all the students think that it is just like the systems and also you can't correlate it with that. So these type of topics like formation of germ layers, in topics of embryology, there are little bit complex topics which can be considered for tutorials, and the internal structure of chambers of heart, even some topics of CS like pathways and all, or some internal structure of spinal cord and all, you can consider those for the tutorials. So they can be dealt very well, and in a small group the understanding level is better. Coming to the group discussion, again, we are very well aware about this. This is a methodological and structured discussion of a specific topic. Again, a number of students will be 15 to 20. Only thing we have to look is it should be teacher controlled, because there are various methods of group discussion. There is free discussion also, but it may lead to some other way and your objective may not be achieved. So here, only thing you need is it should be teacher controlled. Teacher should be a leader for that, and a subject expert should be there. Then the group discussion topics can be anything as per the requirement. There are a number of topics which can be led. Again, a complex topic also can be taken, or smaller topics where the students can equally contribute. A student can contribute. The students' contribution is must. So a topic of medium level difficulty can be taken into this while we are considering the group discussion methods. Coming to the next one, this is something very new, a problem-based learning method. Here, the name itself suggests problem learning. So here, the teaching actually starts with a problem, that is, you have to consider a clinical problem, an instructional student-centered approach which uses carefully constructed clinical problems as a context for students to define their learning needs, conduct self-directed inquiry, integrate theory and practice, and apply knowledge and skills to develop a solution to a defined problem. So there are a number of things. We'll just go step by step. And the next slide will help you to explain the steps of problem-based learning. The intent of problem-based learning is to challenge the learner with problems found in practice. And that problems will serve as a stimulus for learning and focus for organizing what has been learned and for the recall and application into the future works. So it is more of a focus on teaching to focus on learning investigation of real world. We here start with the real world problems that are being constructed as a clinical scenario, and step-by-step approach is there. I'll just share it. Now here we have the PBL process, where again it is a small group discussion where it consists of small number of students between 6 to 10. And it is facilitated by one or more faculty tutors are there who guide the process, and they don't contribute. These faculty tutors should preferably from the other departments, because if the teachers of Rachana Shari are involved into this, what will happen? We can't control our urge to teach, because being teachers, we always have an urge to teach, and that is really beyond our control. So it is always better that if it is possible, because again, feasibility in problem-based learning matters much more. You can have teachers from Kriya Share department or Sanskrit Sahita, and when they are conducting the PBL process, you can act as a tutors, and the tutors guide is being provided to you. So here we have this sessions for 2 hours per session, and we're completing a case in 2 or 3 sessions. So, sorry. Now, what is the steps in PBL tutorial? First, you have to design a case. A case has to be presented. Paper-based case is there. Then, from that case, you have to identify the cues or the key information. Depending on the key information, you have to generate and rank the hypothesis or create an objectives. And then you have to generate an inquiry strategy, how you're going to look into the things of finding all those things, define the learning objectives. And after that, all this has to be done in one session. In the second session, they have to report back where these learning objectives will be elaborated by that particular group. And then the whole of these 3 sessions are integrated. And if it is thought of that a teacher of Rachana Shari needs to just run a very short lecture on that, whether all these points were covered with PBL or not. So if I give an example, I think these steps will be more clear. So this is a scenario, this is a scenario for Pranava Stotus and anatomy of Nasal Sharif. So Here we have framed the scenario, that is Amit, an engineering student of 18 years, came to the OPD of MGSC with the complaints of Jwara. I have just focused that we have not only written the words here like modern terminology. Used of the Ayurveda terminologies is must, because this is right from the first year the students get oriented into this. So complaints of Jwara, Nasastrav, that is running nose, Shavathu, since 3 days. He also complained of Kanthashul and Galavarod. On examination, there was redness of nasal mucosa and araktata and shoth in the Gala Pradesh. He was given proper medication and was asked to review after 5 days. Now, from this scenario, you have to identify which are the cue words or which are the clue words which are important for you. Like here, an engineering student, because he's of 18 years. So here, most of you can just see the age and consider all those things. So a student, when he might be into the studies and uh, driving the bikes, and also all this pranava shrotas vadis are more prone to happen in all these cases. So jwara again, next is jwar, that is fever, nasastra, shavathu, that is sneezing and watering of eyes, kanthashul, pain in the throat, galavarod, congestion of throat, and on examination, redness of nasal mucosa and araktata and shoth in the Gala Pradesh. That is redness and inflammation of the pharynx. Now here, you can just identify that which are the areas pertaining to your subject where you need to focus. Like all these symptoms are looking towards the Dushti of Pranava Srotas. So here we can have the objectives from Srotas Sharir, that is Mulasthana of Pranava Srotas, and Dushti Lakshanas of Pranava Srotas. And when we combine it with the modern anatomy, it is here, as we have said, that is running nose. That means the anatomy of nose has to be there. Sneezing and watering of eyes. So the lacrimal apparatus is also involved here. Okay. And on examination, the nasal mucosa and pharynx is involved here. So here, considering the things, here the student needs to describe the anatomy of the pharynx, describe the anatomy of nose and lacrimal apparatus. So now these learning objectives will be discussed, and the student will go back next week. They will come and they will compile the information. That particular group will compile the information of all these objectives. They will present it. Then again, the next scenario that after the pharynx, you can go on through the lungs also. So that can be covered. But one more most important thing while going for PBL scenario is, like, you should also consider that because this PBL approach is a student-centric approach. So leaving it all to the students will not suffice, because even if we consider this respiratory system, it is an important system where questions can be asked. So even if we are practicing PBL, a short lecture, what we do exactly at our places, after completion of these 3 PBL scenarios, 3 weeks, and the 4th week, we just run through a whole all the PBL scenarios where all the objectives are covered. So an overview is being given. A short lecture is being taken by this faculty member, and they cover all of them. So problem-based learning, it starts with a problem. It starts with a clinical problem where the objectives have to be taken up by the students with the help of the tutor, and they have to find out the objectives. They have to work on the objectives. They need to keep the presentations ready. They need to collect that particular literature, particular matter for their studies, and has to be presented in front of the whole class. So this is the way how the PBL process is approached. Okay. Now, coming to the next, that is integrated teaching. Integrated teaching, the word integration itself suggests where that is coming a combination of or coordination of different teaching learning activities where they can be an effective learning. So this is a very simple type of teaching as compared to problem based. Here, when we come to the basically integrated teaching are of 2 types, horizontal and vertical. Like in vertical teaching are for higher classes like second BMS or third BMS, where the basic departments of, like for example, if Shalle is conducting integrated teaching on hernia, So they will ask the anatomy people to contribute for the anatomy on all. But here, when we come to the first BMS students, it is horizontal integration where only the departments of first year are involved. You can involve the departments of Sahita Siddhant, Kriya Sharir, and Rachana Sharir together. And now this is one example I've just put. Anything can be because most of the topics of Rachana Sharir and Kriya Sharir are matchable. Like previously, we used to have our topic on Purush Vichar because Purush was included in our first in the previous syllabus. So we used to have integrated teaching on Purush, where Sahita people used to contribute on the aspects of which were given in Sahita. Anatomy people used to Rachna Sharir people used to contribute, and Kriya Sharir also. Now here I have given an example of combined teaching learning of renal structure and function by Rachna and Kriya Sharir, where the structure of kidneys will be taught by the department of Rachna Shari, and the functional aspect or the Kriya aspect will be taught by the people of Kriya Shari. Okay, even if you just consider Sahita people also into this, so Mutrotpatti, when we consider the Mutrotpatti, and as given in the Sahita, that portion as a part of functions can be included by the department of Sahita Siddhant also. So it will be a combination of teaching by all the three departments. A particular topic has to be taught. So even the students will be in alignment. So the whole of the urinary system they will be learning together, like anatomy, physiology, and from the Sahita part also. Okay. Only thing is that you have to look into that it should be of the same term. Like first term topics only should be considered while you are teaching. Even you can consider for endocrinology. You can teach anatomy department can teach the structure, and the functions can be taught by the department of Kriya Shari. How the module has to be designed, you have to make a list of participating departments. See, implementation is you have to, if you implement it properly and because documented, it should be documented also, because when we consider the further views also, we all are into the process of accreditation, so we need lots of documents, and these documents will be helpful when we are asked for the teaching learning process, that is criteria 2. So I will just suggest that all the documents of your department should be with you. And hence the integrated, if you're practicing integrated teaching, you need to have the documentation of that, where you will have a timetable for that, list of participating departments, which you're conducting, list of participating department, Share department covered by Kriya Share department, and how you're going to SAQs that you have to design, the teaching learning methods and media that can be used, and the timetable, because it has to be incorporated in the timetable. So like if it is every Thursday, now first Thursday who is going to teach, second Thursday which department is going to teach, and also the list of learning resources has to be provided. So your module has to include all these things. So this is a wonderful method where both the departments, specifically Rachna and Kriya, and even Sahita in some cases can contribute to this. Now this is something again new, early clinical exposure. Exactly the word here early suggests that it is at the very first year when the students enter into the medical profession, as early as the first year of medical education. Now, basically, when we go into the conventional or traditional teaching, students are exposed to medical education particularly enter, that is when they go into the but early clinical exposure provides us an opportunity when first year students, they are really
Please stay connected. Maybe man disconnected.
Hello.
Yes, sir. Yes, I'm there. Just a minute.
Okay. So by the time my ma'am joins, um, was thinking to share this course learning outcomes. So as per the previous discussion, you have seen that we have linked our graduate attributes to program outcomes. So for program outcomes, we have seen this 1, 2, 3, 4, 5, 6, 7, 8, 9. So first outcome was Trisutrasya Ayurvedasya Jnata. So probably it becomes applicable for almost all the part of the syllabus. So here the course outcomes for Rachana Sharir are: first, describe the fundamentals of Rachana Sharir, interpret and analyze in a relevant context and recognize the significance of Ayurveda. Second is explain the Garbha Sharir and embryology in Ayurveda and modern science respectively with clinical significance. Third course outcome is describe and demonstrate all the bones and joints with attachments and associated structures and its clinical applications. Fourth is explain the concept of Sira Dhamani Srotas, their organization in the human body and its applied aspect. The fifth course outcome is identify the marma and understand the classification along with the importance and preventive and therapeutic aspect. So you can recognize just by reading this 10 points, any student or any person will recognize what will be the outcome after first year, what we should expect from the student. So seventh is appropriately explain the Indriya Sthan, Indriya Sharir and sensory organs. Eighth is identify and locate all the structures of the body and make the topography. Respect the cadaver. So this is an affective domain. So these are again in all the three domains: cognitive, psychomotor, as well as affective. Respect the cadaver and perform the dissections with commitment to reiterate the theoretical aspect of Ayurvedic Rachana Sharir and contemporary sciences. Describe the basic principles of imagining. So that part is also covered. So these are linked to appropriate program outcomes. And here, when we go ahead in the third table, so this is the second table where you have a topic list and description. And here, this Sharir, first topic, it is again linked to the course outcome 1. So first course outcome is covered here. There may be one, there may be more course outcomes for one particular topic and one particular objective. Ma'am, are you here?
Yes, I am going to share the screen. Ma'am will connect with the mobile.
Okay.
Okay. Hello, ma'am. I am audible?
Gaurav sir?
Yeah, I'm there, sir. Hello.
Yes, ma'am. Continue.
Joshi, sir.
Continue, continue. ma'am.
Sorry for the inconvenience. Yeah, okay. So I'll be just on early clinical exposure. Now, I think Gaurav, sir, are you sharing the screen?
Yes,
Gaurav,
yes,
please,
yes, yes.
Yeah.
Yes.
What? Yes, fine. So the goals of early clinical exposure is to just we have to that will be a combination of knowledge, skills, and attitudes. So it provides context and relevance to the basic science teaching. Now here, just go to the next slide, please, sir. Gaurav, sir, just go to the next one. Yeah, this is the need analysis slide. And why exactly early clinical exposure was needed. If you just look into this slide, see the first year students when they enter into it, it is all they are with overburdened with the new terminologies, and most of the lectures they are mostly into the theory classes are there, except for the demonstrations or dissection classes of Rachana Sharir and practicals of Kriya Sharir. They are not having any exposure, and most of them is a theoretical knowledge. So like studying the Satkaryavad, Vivartavad, Ashtaprakriti, Shodashvekar, the Srishtiputtatikam, all the things they think that how is this the way I'm going to be a doctor? Really, whether I've landed into a particular appropriate field or not. So this was what exactly need analysis was being done. And since 2015 document which was MC, and then we are already practicing it. I have already a corporate document on this need analysis also, and it really works very wonderfully. So coming to the next, how it is practiced. Please go to the next one. Where to where can the early clinical exposure be practiced? Where to use EC? Next, please. So here, just go on. So where to use EC? Gaurav, sir, please click it. So you will have it into three settings like classroom setting, hospital setting, and community setting. In the classroom setting, we can have case discussions, that is case-based learning, or when a patient can brought into the classroom. Like I have given you the scenario of based learning, the same type of scenario or case discussions or paper-based cases can be there in for the classroom setting. Bringing a patient to the classroom is little bit a difficult task, but if the patient is comfortable, you can just get it. But most of the time what we practice is designing a paper-based cases and discussing it into the class. So that is how it goes for classroom setting. uh, the cases are discussed. It starts not with the lecture but with the cases. Then coming to the hospital setting, the students are taken into the hospital, and they if you, for example, if I'm discussing or I'm teaching them about the knee joint, I'll put a case on a paper-based case will be there, which will be discussed. Then the students will be taken to the hospital, and there the patients of knee joint disorders, like it may be Amvat or it may be any other cases where the Janusandhi is being involved, that can be shown to the patients. So the students are exposed to the hospital over there. And the next is community setting, where the community visits can be there. There you can just like for there can be awareness program that how your joint can be protected or how the care can be taken. So here in early clinical exposure, the knowledge there, but it also involves the clinical skills. Like clinical skills is not examining, because in the first year will not allow the students to examine, but the other affective domain values like communication with the patients, the fear of interrogating with the patients, behaving with the paramedical staff, the first fear of entering into the hospital, or first apprehension of the entering into the hospital and getting acquainted hospital environment is little bit, they will be very comfortable when they go into the clinical use. And when the things which are taught in the theory class are, they will see the same things. They will see the same things in the patient. They will be reinforcement of knowledge, enhancement of the knowledge, and the retention of knowledge will also be good. So you can use even X-rays also. If there are a number of cases or number of things which can be used for this particular purpose. And coming to the next thing, go to the next slide, sir. So case-based learning, how a case is established, then is analyzed, then there will be a brainstorming on that, what are the particular things in that particular case, and formulating of learning objectives will be there. Dissemination of the new findings, what they have found new in the cases, and then the group will share the result. So here they'll be identifying the areas of improvement and integrating into clinical practice. So how this whole scenario of, rather than going for teaching of anatomy of
Hello, madam.
I'm calling, sir. मैम अनम्यूट ने प्लीज डू द अनम्यूट मैम एक्चुअली मैम अनम्यूट नहीं हो रही
how else can you use these cases to teach? You can use the paper-based cases. You can have photographs, X-rays, and laboratory reports. And the teaching methods can be small group methods, clinical visits. The topics where the EC can be implemented are Asthi-Sharir, Arthrology, Stotha-Sharir, Marma-Sharir, then endocrinology, surface anatomy. You can just teach the surface anatomy on the mummies. But when you go to the hospitals, you need to integrate it with the departments. Again, one more thing is when we plan about early clinical exposure, you have to talk to those particular departments. Like if you're showing the patients from Kai Chikitsa unit, you need to have a communication with them, plan the timetable accordingly, and the physician or the faculty from that particular department or a PG student from that department will be present there. Okay, and you have to take the students in batches over here, like surface anatomy of the liver. You can just palpate and show the students. The students will only observe the things. So how we are going for all those things can be exactly what we're teaching them in theory and practical. All these things can be shown to them through the early clinical exposure cases. So again, when we go into the community, you can have lots of things which can be done in the community settings also, like creating awareness about those particular things. For example, there are many chiropractic practice like Marma Shariram or Marma Chikitsa is being done. So even the awareness about this Marma Chikitsa can be done. Okay? And preventive aspect of the joints and all can be communicated through the community settings also. So this is about early clinical exposure. Gaurav, go to the next one, please. Next, please. Self-directed learning. So these are a few methods: reading books, notes, and web search, where the students can go for their own learning. They will decide their own learning skills. There is program learning also now. Actually, we as teachers have, and as the new teachers who are there, they can just, and more of techno savvy things are there. You can have a program tools, like where half of the things are given, and step by step they will have an approach, and they will select those particular correct answers, and then they can go to the next one, and the whole learning process can be completed. So you can design computer programmed learning for that. Projects, assignments, and conference are other means. Then again, there are web-based learnings where you can just give them the you can provide them the web links to them, and they can just go and study on their own. Those who are interested, like this can be for the rapid learners. Who are rapid learners, they can have more of better learning, and more of self-directed learning. So self-directed learning tools are many, and it is depends on the students and the teachers how they have to be they can be incorporated. Coming to the next one is video based learning. So we all are aware about this. I need not much more focus into it. But as in the very first slide, when Joshi sir was discussing, he was telling that only going for theory, if we just visualize the things, there will be more of retention. So only going and telling them about particular procedures or particular thing, like we are going for arthroscopy, we are going for pleural tapping. Only going theoretically, if you show them the video, which are the points where the pleural tapping is done, which are the sites where the tapping can be done, okay, where the lumbar puncture is being done. So all these things, the students will, when they visualize the things on a video, that will give them a better retention of knowledge will be there. And again, this will help in much more retention also, and this method is more enjoyed by the students as well. Okay, next is virtual learning. So virtual learning, we all know this is a 3D environment, and nowadays it is more into focus where there are lots of, specifically in the modern science, there are many tools where you can use this virtual learning, and the 3D environment is being used. Then this is an anatomy table where I think few of our institutes like NIA, and they have, we also have this anatomy table, and few, I think NIA has also recently purchased this anatomy. So this is also very is useful, but if not possible, we can also have other virtual aids, because this is little bit costly. But actually, it serves a good purpose. So that can be used. You can give the sites. There's a few sites for virtual learning. Like Naters is one of the best one where we use Naters. Then again, there are many more. You can search into that. So field visits are there. This is another one where, Gaurav sir, please go to the next one. Next slide, please. Next one. So these are the virtual sites for virtual learning. Then field visits. You can have community visits. In the previous, where the previous MSc was there, where it was compulsory that some villages has to be adopted and the field visits are compulsory. So when it comes to Rachana Sharir, we can have community visits, and we can visit the centers for awareness for body donation and organ donation, because here it is where affective domain part is being more focused on, because when we learn theory and practical is more of there, so it's more of cognitive and psychomotor domain. Affective domain, where we can create awareness for body donation and organ donation, and that will be really just going, and we can contribute to the societal goals also. You can also have your visits to the anatomy museums of elite medical and Ayurveda colleges. Even many of our Ayurveda colleges have very good and Rachana Sharan museums. So even you can plan for that to visit also. You can take your students, because again, field visits are again compulsory and mandatory when it comes to NAC accreditation. So you can even plan and ask your, in the private colleges also, you can ask the management to do that and arrange for that. So field visits can be done. Next is, coming to the next is role plays. Role plays, as sir said, even Prasad sir has emphasized on this. It is acting out a situation, and this is more for, again, for affective domain, like communication skills, how to deal and deal with the patients, how to communicate with the patients, how to communicate with the paramedical staff. So this is when it comes to study the behavioral patterns. Role plays play a very important role, and this projects are also been taken up. And if you just go into the detailed literature of role plays have served as a very effective teaching learning method for development of affective domain and communication skills and behavioral skills. So you can enact, you can even ask your PG students, or if you, it is better to ask the UG students only to just give the theme and tell them to come out with that particular thing. You give them the idea, and it is experienced that the students come out with very beautiful performances, and they get the things also, and then it is being watched by the students. It also gives your objectives are also being met with, and the affective domain is being very well covered through role plays. Next, please. So here, these are the few methods which are being enlisted in our new curriculum. So I would just say a judicious blend of various relevant teaching methods will enhance the teaching learning process. Next, please, Gaurav sir. Yeah. So this is the take-home message. A judicious blend of various relevant teaching learning methods will enhance the teaching learning process. So it is up to us how we take up these methods. The new curriculum has really met it with very well, and it can be very well done. So coming to my last slide. So I think is unable to share. So let us be the partners in change, and thank you very much. And I'm really very sorry for the inconvenience caused due to the network issues, but that really is not in our hands. So something is, there are some cons of technology, but I think I have tried to orient you people as far as possible. Anything needed from my side will always be there to help you out. So, and any questions after this, that can also be done. Thank you so much.
Madam, just wait, ma'am. Madam?
Yeah.
Can you just elaborate a bit, because that was also our objective for this session,
Yeah.
to this second table, and what are the exactly changes, and
Yeah.
just a few words from your side.
Yes, sir. So here the table 2 is contents, where we have in B2 it is the term, and marks are given there, and the lecture hours. Lecture and non-lecture hours are defined over here. So if we just consider the first one, that is Sharirupakramaniya Sharir, here if we this is all in relevance with the hours allotted. How many hours are allotted to that particular topic? We have calculated the marks accordingly. So as per the hours given to that particular lecture, we have distributed the marks, and the total lecture hours again have been divided into, if we just, the first topics mostly here, non-lecture hours are less, because these are most of uh, conceptual parts in the paper one, like Sharirupakramaniya Sharir, Paribhasha Sharir, Garbha Sharir. These are all conceptual parts. So you will just find that the non-lecture hours are little bit comparatively less. But as we go further and go into Sandhi Sharir, yes, if that is visible, if we go into the description of Sandhi Sharir, so here more of the demonstrative classes are being planned over here. Okay, more of demonstrative classes will be planned here, and accordingly the marks are also given. Now there were few things that some some of the questions or some of the topics are not covered into LAQs. But if we just look into the assessment, when we go, Dr. Gaurav will be focusing on that. That particular part, you have to, considering the marks, you have to go into particular things. Then coming to this table number 3, sir had already, Joshi sir, I need to elaborate this also. Yeah. So here, if we just consider the first domain, that is 3 major domains: cognitive, psychomotor, and affective. Now, when we are considering defined Sharir, it is only a recall part, that is at the lowest level. The students have to memorize that shlokas memorize the verses, the sutras of definition of Shari. Okay, and when it comes to the must know, desirable to know, it comes under must know. It is a knows part because student need to know it, because knows how is a further part when it goes to analyze the third CO. Methods here are given, that is lecture methods, because these mean conceptual parts are through lecture methods only. And how they are going to be assessed. The assessment methods are given, that is written method, viva voce, open books and tests. And these can be asked in the formative exam and summative exam. The last part is the last column. Here it is not seen, but it is in department which can be integrated. So here, though it is not in the Sharir Upakram part, but when we go to Garbha Shariram and all, so you can have you can just have integration of Prasuti and Srirog department. Okay, like when also we are teaching other applications of all those applicability part, you can involve Shalya department, you can involve Chikitsa department. So even the last one, like where it is shown, department of Srirog and Prasuti Tantra. Role of Tridosha and Panchamahabhuta in the fetal development. This can be collaborated with the department of Stri Rog also. Okay. So if we just go further, you have just cognitive / knowledge is given there. Okay, in somewhere it is comprehension. Comprehension is again after recall, it will be comprehension, that is understanding. So the student not only need to memorize the thing, but they need to comprehend and understand the things. Again, in some cases, when it goes to the application part, in the further tables, if you will be going, here see, describe the umbilical cord with its exam, umbilical cord. So here you need to find the applicability of what are the anomalies of the umbilical cord. Okay, so application part is also been covered over here. When it comes to applied anatomy, the application process will be involved there. Okay, analyze and synthesis, these are not involved considering the level of learners, first year learners. So we have mostly kept it to application. In some cases only it is analyzed, and then whenever it is analyzed, it will be into DK, because that is again a higher level of learning. Okay, it will be into desirable to know.
Yes, ma'am.
Wherever there will be demonstration techniques, where we are demonstrating the muscles, it will be shows. You have to show the things. Okay, so this is like how we are going to read this table and understand the table. More important is understanding this particular table. The things are being made very easier for the teachers. Okay, so you need not go much into it. Everything is being provided to you. You only need to implement it. I think the same has to be understood in a similar manner.
Yes,
the whole
ma'am.
of the
Yes, ma'am. Yes, ma'am. Yes.
syllabus, yeah, the same.
Yes,
manner.
I'm just looking for something that we can ask as a specific for Rachana Sharir. So I was just scrolling down through the file, but it's okay. Animated method, lectures, discussions, problem-based learning, early clinical exposure, demonstration, group discussion, all the points are covered by you. Thank you so much, ma'am. And this
Yeah.
is how we have to
Yeah,
remember, understand.
Sorry for the inconvenience caused due to the netting issue.
Yes, and for those, there are many short forms used in these TL methods. And at the bottom, you can just find the description, just the abbreviations, those are used. The appropriate names of those appropriate abbreviations are given here. You can read this. Okay. So I think I will stop sharing here. And Gaurav sir, are you here? Thank you, Priti ma'am.
Yes, sir.
Thank you.
Continue.
Okay, sir. Thank you. Slides are visible, sir?
Yes, sir. You can go full screen, sir.
Okay. Thank you
Yes,
very much.
it is visible, sir. Continue.
Okay, sir. First of all, I thanks to the authorities of NCSM and especially our president, sir. Looking toward this session is totally dependent upon the assessment methods in the new curriculum. we can go through this 6D evaluation method assessment method. This is the table showing that the evaluation method for the periodical assessments. The practical, clinical performances, Viva OC, open book examination, summary writing, class presentations, problem-based assignments, then OSPE. These are all the methods we will include in the curriculum. Then the extracurricular activities, small projects, and other activities which are enclosed in the table 3 under the column G3 as per indicated terms and the objectives of the topic. So we can go one by one to the assessment method. One of the assessment in the practical, what we can going to be conducted in the practical as a part of the examination or as a part of the assessment. The dissection, we can ask the question and answering while doing the dissection and the cadaveric on the cadaver. The another part is the virtual dissection through the anatomy or the dissection software. That's earlier Dr. Preeti Simon told about that anatomy and dissection softwares. Some demonstration we can conduct it at the question answer with the question answer on the models, some soft organs and the bones and etc. which facilities available in the department. Then radiological questions, the radiological anatomy we can cover with the help of the X-ray Weaver box, which is available in all departments, and the surface anatomy. If the mummy is not available, we can plot the points on the plain paper, and we can ask the students to go through all the points, and we can ask each and every organs about the surface marking. Then the Viva OC. What is the Viva OC? Is the examination is an important tool of evaluation in the examination, but followed by the high subjectivity. There is a high subjectivity in it, that the gross subjectivity is in the Viva OC assessment can be reduced by this structured Viva OC. One table is introduced in our new curriculum, there is the structured Viva OC. It is primarily concerned with the comprehensive application of the fundamental information and concepts, as well as the implicit logical validation in the highest level of cognitive domain. It is geared on the analyzing, the developing, and assessing the truth of the depth of the knowledge. Furthermore, it successfully assesses the emotional domain, attitude, communication power, and the conviction power of the students. This table is already introduced in our curriculum, bifurcated into 3 parts. There's the recall questions, comprehensive questions, and the application questions. The recall questions have the 40 marks, and these are the topics we are given for the recall questions. For example, definition, types, numbers, planes, parts, and the shloka, etc. Under the comprehensive questions, there are 20 marks we have given, and there are the 4-5 topics. There's the nervous system, endocrine system, lymphatics, cardiovascular, urinary system. We can ask, for example, the relations of the various parts, blood supply for the particular part or organ, blood supply, venous drainage, or lymphatic drainage, etc. Under the application part, we can include the applied anatomy, clinical anatomy of the particular system or particular part. Then the surgical anatomy or the congenital anomalies during the development of the various systems. Another method is the open book test. What is the open book test? It allows the students to take the notes, text, or access to the resource material into exam situation for a limited time. We can give the resource material in the classrooms for the open book test. This is for testing ability of a student to find and apply information and knowledge. Student can give their ideas, they can search materials with the available resources for the open book test. We can take one example for that. In this curriculum, we are explain, for example, we will explain the term Kandara, Kurcha, Mounser, Raju in the context to its information sites and the structures. Here, open book, if you want to conduct the open book test, for example, we can take the fill in the blanks of the Sanskrit verse, then the pictorial questions to identify the entities we are showing on the screen, then ask for the complete recitation of shloka. They can search the slok and they can complete the recitation. Then I display the slok and ask for this reference. We can display the slok and they goes through the various references or Sanhita and search from which this text is available. So with that method, the students are going to search another material also which is not asked by the teachers. Next one is the summary writing. There is a research paper or the Sanhita. It is the brief summarization of a larger work that gives the reader a comprehensive understanding. That is expressing the most important facts or the ideas about something or someone in a short and clear form. For example, we can ask the student for the review article for a particular topic, which we taught in the lecture. Another is a literature review. We can ask for the literature review also from the essay, short essay, or another part of the text. Then we can summarize the Sharisan Adhyay. We can ask the student kindly summarize the first or second. That was taught in the lecture. Summarize this lecture in our own new language. So there is a thinking or critical thinking may develop. We can go in the free hand to the students. They can implement their ideas for the summarizing the some adhyay in the context of that particular scenario. Another is the problem-based assignment. We have to teach the problem-based learning in the earlier part. Is the problem-based assignment is there. It is a student-centric approach in which the task regarding the particular part of the curriculum is given to the student to learn about the topic by working in the groups or individual to solve the open-end problems. We are going to give them the problems and they are going to be solve it. This activity drives the motivation and learning in the students. For example, if you take on this example as I described the joints of the upper limb and the lower limb regions and temporomandibular joint and its related applied aspects. If we want to teach with the assess to the assignments, there is a problem assessment. We can give one example. There is a young boy of 3 years was brought to the hospital with a complaint of lunging gait during the walking. The tender test was positive. The doctor explained that this was a congenital condition. Which joint is involved in this case and write about the types, articular surfaces, ligaments, and its anatomy, its movements. This is the one of the problem, and students have to investigate about all the problems and they can find out solution with the available resources. Another example is the young boy of 16 years was diagnosed with the bucket handle tear. Identify the joint in which this type of tear is seen. This problem is have to think. The student will going to be going to the thinking process and where this bucket handle tear was found, and they are going to be search the material regarding the bucket handle tear and which anatomical part is included in it. Hence, to write in brief about the main ligament involved in this tear and write about the movements related to that particular joint which is affected in in this case. So this is the problem-based assignment. Another part is the objective structure practical examination. There is the OSPE. What is the OSPE? The assessment of a practical knowledge involves the oral, spot, and this objective structure practical examination. OSPE can relate to the osteology, imaging, cadaveric dissection, histology, embryology, neurology, and some other surface anatomy part. But also it integrate with the pathophysiology of some diseases and clinical aspect of the diseases, which are going to be taught in the early clinical exposure, which earlier session we discussed. What is the main difference in between the OSCE and OSPE? What is my OSPE and OSCE? And what is the difference from the spot? In the spot, we're going to be brief introduction about the OSPE and spot. In OSPE, at one station, one specific objective is to be tested, but opposite to it, in the spot, we are going to be there is a multiple or mostly unrelated objectives are tested at one station. For example, pointer, we can pointer on the pectoralis major muscle and the pointer on the great sapinous muscle. Means at the one point, we are going to be asked 2 questions with different points. In the OSPE, the text test the higher level of knowledge domain, but in the spot, we're going to be assess the lower level of domain. In OSPE, there is a test ability in relating the identification of structures on the cadaveric prospection and the models to clinical and the laboratory data. But simultaneously in spot, we are going to be conduct. It tests the ability to identify structures on the cadaveric procession and the model only. There is not a clinical and laboratory data we are going to be asked. In the OSPE, another point is the test the ability to identify the structures on the radiological images and relate them with the clinical aspect of the disease. In spotting, we are not going to be relate that with the clinical aspect. The stations are organized to provide an integrated multidisciplinary based test, but in spotting examination, we test the knowledge in one discipline only. In OSPI, each question and station is placed in accordance with the blueprint of the examination. And in SWOT examination, there is a random distribution of questions. There is not any sequence where we can produce. So there is a station not necessarily in the accordance with the objectives of the integrated process. So it is the brief introduction about the OSPI and the spotting. So we can take one example for what is the OSPI, which question we are going to be asking in the OSPI, and which question we are going to be asking the spotting. So this is one of the in the example we are going to be taken in the CVS. In the spot examination, the question is added name two branches, and the answer will be, what is my A? A is a left circumflex artery, B is the anterior descending, and C is the right coronary. Second is the name the two branches of the C. What is C? C is the right coronary artery, there is the SS nodal artery and posterior interventricular artery. But exactly opposite the OSP, that is the object structure practical examination, the question is, which of the label arteries is responsible for myocardial infarction shown in the case above? There are three vessels are shown, that the A, B, and C. Which of the label arteries is responsible for the MI? The answer will be the C. When a student will just going to be in critical thinking, which out of them, which is responsible for the MI. The example, we can create many examples for the OSPI and spotting. So next part, we are going to cover the extracurricular activities. What is the extracurricular activities? There's a social work, the public awareness. The social work at the college level is an integral link between the college, home, and the community, which helps students to achieve academic success. They work directly with the college administration as well as the students and the families, providing that leadership in the forming the college discipline policies, mental health intervention, crisis management, and support services in the crisis management. We can take one example for that. In rachana curriculum, there is a part, there is a describe the body donation and the organ donation process with respect to the specific organ and its awareness. That is the affective domain, the psychomotor in nature. And we're going to be covering with which type of test we can be conducting, that is public awareness and social work. So what is the relation between that curriculum and public awareness and social work? If we are going to be assessed, is very compatible to those of a general population. These results demonstrate that one of the articles is published on the PubMed. The finding of that article is that the level of knowledge on organ donation was not optimal, which indicate the necessity of an increase in the awareness regarding the organ donation in the medical undergraduate students. And another survey is organized by the Economic Times, which is published in the paper. The organ donation, there is an urgent need for the social awareness in the India. Is the burning area in our nation. We are not finding the organ donation and most motivated people for that. So if we conduct this public awareness, social work in our curriculum during our course, there is the 2 points we have to find out at the student end and at the end of the society. At the student end, what we are going to be assessed? We assess the student to assess the perception and intention of the student regarding the organ donation. What is the intention and the perception of the student behind that organ donation? We are going to teach all the organ donation, the timing in between, how is to be conducted, and this process we are going to be taught in the will be taught in the lectures in the our curriculum. On the student to society end, what going to be happen? There is to be assess the awareness and attitude regarding the organ donation among the rural and urban population, and to evaluate the socio-demographic factors associated with their awareness. So in one way, we are going to be achieving the two goals, which is more beneficial to our nation, and it is the best contribution from the Rachana department or Rachana curriculum to our nation regarding the organ donation. Another part of our assessment is the project work. How is going to be conducted? In a project-based learning is not only to provide opportunity for the student to collaborate or drive their own learning, but it is also teaches them the skill. They are going to apply the skills. They are going to be thinking about the various aspect of that project, and helps to develop the additional skills integral to their future, such as critical thinking and the time management for the specific project. The project work is to produce the authentic assessment for the students. It's create and study something that was interesting and engaging the students in the curriculum. It's going to be create an interest to the students. Then third one aspect is provide some real world experience to the students. They are not going to be taught in the didactic teaching. Hence, the NCSM introduced that project-based assessments for the students. For that purpose, we're taking two examples for that. If the two topics are there, one topic related to the fetus, there's a monthly development of the fetus, and another one is the if taken my example, the recognize and describe the radiological structures in the radiograph. If you are going to be asked the students for the project work, there are some examples listed here below it. These are not only four. We can add a lot of project works to the students as per your creativity. The creative teachers may create a lot of project works for the students and for the contribution to the curriculum. We can, I am going to read some of them. The model preparation of development of a cardiovascular system and the respiratory system. Second one, the anatomical range of variations seen in the anthropometry of the ear. Then third one is the collection of diseases based on the radiographs. Student may going to be collect some radiograph related to particular disease. The study of major radiological variations. These are few pointed here, the projects which are going to be conducted in our curriculum, and we are listed in that table 3. So which part of the curriculum will be assessed or will be taught with which the teaching learning, and assessed with the which part of the which type of the teaching assessment method. There are some assessment methods also available. There are the multiple choice question and Google form quiz. We can take at one time within 5 to 10 minutes a Google form quiz. We can give the link to the students, and students going to be solve the quiz within a few minutes. There is a classroom quiz. There is a rapid fire questions with the students, and we can involve all students with that activity. The modified essay questions, we can do some modified, likewise the class test, short answer questions or some essay type questions to the students, and students going to be solved in the frame time period in the classroom. In the non-lecture hours, we can conduct this type of activities. Earlier, Dr. Mohan Joshi sir said about that some topics are converted into themes for the better understanding or better inclusion in the curriculum in the question paper. So there we combinedly put that topics in the some themes, means the Sharirogram Paribhasha Shari, that combines the Garbha Sharir and embryology. So we can ask the student, we combine question on the basic on the basis of that themes. It is not compulsory to ask the question in the combined form. but to facilitate the easy mechanism to the teachers so that they can ask the questions in combined form also or separate form also in the examination. So because of that, we are going to be frame these themes, theme-based question, and given the marks are given in front of them, and MCQs which are from the SCQs and the LAQs are there. These are the topics in the first paper. Second table comprises of the Kushta evam Ashay Sharir, the digestive system, then Praman Sharir and the Marma Sharir. Sira Dhamni Srotas with the cardiovascular system, Indriya Sharir, Tvacha Sharir with the sensory organs. So these topics are clubbed to facilitate the mechanism of the setting the question paper. These are the templates, blueprints given by the NCISM in the curriculum. These are the blueprints of our question paper. On these blueprints, we are going to ask the question in the with the permutation and combination. We can ask this particular question to the students. There is a much part. There are 15 MCQs from the much know parts, 3 MCQs from the desirable to know parts, and 2 MCQs from the nice to know parts. In a short answer question, there are 5 questions are there, and five marks to each question, and total questions are there, 8 questions are there. From the must know part, there are seven questions, and from desirable to know, there is 1 question is there. In the long answer question, there is no question from nice to know and desirable to know. All the questions are from the must know area. So these are the 2 templates for the paper 1 and paper 2. Then coming towards the practical examination, the 6HI is table is included in our curriculum. That's showing the spotting. There we have mentioned the refer table 6H2, and below this table there are so examples, and you can put towards for the corresponding examinations. There is one of the heads is the Koshta Ashay Shari, the sector organs and histological slides. Asti Sandhi Peshi, bones and the joints. This is earlier also it is in our practical examination. Marma Shari, surface and radiological anatomy. One innovative part is included in NCISM by NCISM in our practical examination. There is a 15 marks to the practical record and 5 marks for the communication skill that we have to assess during the practical examination. So this is the one innovative finding is there in the practical examination. Another part is the structure viable object structure viable OC, means OSVV. For that, we have to refer that table 6S. We earlier mentioned in our presentation that simple questions are there, some difficult questions, and some practical based, comprehensive based, and applied questions are there. We have to ask the students under the particular categories, and some examples also given below the table. And for the internal assessment, there are 30 marks of internal assessment, total 200 marks exam, 200 marks for the practical examination. So at the end of this lecture, I'm just going to be said, the assessment is today's meaning of modifying tomorrow's instruction. So this is all about the assessment methods, which are going to be on which we are going to assess the students in our throughout the 1.5 year curriculum. And you can take your innovative ideas, or you can give your suggestions which can be incorporated in future or in our curriculum to engage our students or enhance our the capacity of students in the in coming era. So this is from my side. Thank you very much. Over to Dr. Mohan Joshi, sir. Thank you very much, sir.
Thank you, sir. You can stop sharing and stay back. I hope Dr. Preeti is also here. Okay. So participants, if any direct questions related to Rachana Sharif, you can just type in the chat box. Hello. I'm just waiting for the questions. Okay. 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 Yes. Hello. Okay. So we have few questions. The first, go for some questions. Sir, are you sharing?
Yes, sir. Actually, there is one question from the kind detail once again about the Kala Sharir, and they said they are having a question about the LAQ. Actually, it is not for LAQ. It is not. We can don't ask. Actually, there is the Indriya Sharir, Tvacha Sharir, sensory organs, and Kala Sharir. These collective themes, collective topics are to be given for the topic. This theme. So we can ask from the sensory organs and there is one table is also given in the our curriculum for the specific topic, and the marks also given for that. So we have to access this topic, this marks also while giving that particular for framing that particular question to highlight for the question paper, because this 20 marks is given for only the combined questions for the particular themes, for particular topics, which are also mentioned in our the curriculum. That in table number 3, it is the total content is there, and after that just above that this table there is another table is there also given by the given in the curriculum. There is a separate topic and a separate marks also given for that, for the reference for that theme also. So we can ask the questions, the combined questions. Likewise, the Indriya Sharir and the sensory organs or the Tvacha Sharir, the combined questions. Respect to the Kala Sharir, we have to refer that table also. They are mentioned only the, I think there are 4 marks for the 4 or 5 marks for the that topic. So might be you are satisfied with the questions. So satisfied with the answer.
Yes, sir. I hope you have answered the question. Now I can see one more question, is it compulsory? So yes. So yes. So can you please stop sharing? We will keep this file. So whatever question we have, we can just, okay. So we can go to paper pattern and question paper blueprint, and this is question paper pattern. Okay, so here we can see that there is no option given. All questions are compulsory. Multiple choice, 20 questions, 1 mark, all compulsory. Short answer, 5 questions, 8 questions of 5 marks each, all compulsory. And long answer, 4 questions of 10 marks each, all compulsory. So it is written here. Yeah. And if you can, how much max marks for the exam? Sorry, I'm not getting, Abhishek sir, I'm not getting your question. Okay, tell the softwares which can be used for the anatomy. I think there are plenty of softwares. Sir, can you update with 1 or 2? Gaurav sir?
Sir, actually, ma'am also present in her presentation that there are so many. If you are going to be type some software related to anatomy, there are lot of softwares are available. There are free available, and some anatomy apps also available. So we can just Google in the Google Play Store. We can search some apps also for the anatomy purpose.
Yes, but here I will go for a caution that check the app yourself first. There may be the apps with embedded advertisements or some malwares. So practically, before sharing with the students, please, I will recommend that faculty should check the quality as well as the contents of that particular software. Even before sharing the websites, this caution can be taken. This is just a hint for everyone. Can you please explain how do we download the curriculum using the QR code? Ma'am, simple, go to the Google Lens, just scan the QR code as if we scan for any kind of online payment, and you can see the link, click on the link. Otherwise, it is also available on NCISM website. Go to Ayurveda section, go to new curriculum, there you will find this syllabus. Otherwise, I think on the social media, all the files are on the rotation continuously.
Hello.
Yes.
Hello, sir. Can I ask my question, please?
Yes, sir. Go ahead.
Yeah. First of all, a very good afternoon all to the from organizer side and from the participant side. I'm very thankful to Dr. Jayan Dev Pujari, sir, Chairperson, National Commission, and Dr. Prasad, sir, Board of Ayurveda President, for taking this revolutionary step to reform the syllabus, and it will be definitely going to prove a big change in the Ayurveda education. My question is to Dr. Preeti Desai, ma'am. Just now in her presentation, she has told regarding integrated teaching that for first year, we have to adopt horizontal teaching, integrated teaching. But in the column, I can see there are some subjects from third year and some subjects from second year, which are going to be proved that it is a vertical teaching. So can ma'am can clear this thing? Hello.
Hello.
Hello, Priti ma'am, are you here?
Please unmute. Okay, hello. Yes, sir. Sir, yes, you're right. Hello.
Have you heard the question, ma'am?
Yeah, I have heard the question.
Yes, yes, ma'am. Go ahead.
Regarding teaching of when we go for integrated teaching, it is specifically confined to the first when it comes to the major teaching part, because here I was talking about the anatomy and physiology portion, which has to be integrated. And when we and when we are trying to go for the applicability part, that will be in early clinical exposure. We will be integrated. Okay. When we go for early clinical exposure, we will be visiting the hospitals. That time you can integrate the other departments while you're going for the hospital teaching. Specifically,
Okay,
in the hospital when it is an hospital exposure. Okay.
Yeah, that means it is not that we should compulsorily stick up to the horizontal teaching. We can.
Yeah. No, it is, and it is, actually it is not feasible also when it comes to the real ground situation. You cannot integrate each and everything to each and every department. Okay.
Yeah.
So this is when it comes to integrated teaching, specifically that 14 hours you have to cover of integrated teaching. That will be the must know area. Okay.
Yeah.
And that will be only related to the anatomy and physiology proportion only, where the Kriya and Rachana departments can be integrated. Okay.
Yes. Thank you, ma'am. Thank you very much. Yeah.
Hello, madam. Can I speak?
હું જોયો હમણાં ઉપર એ શબ્દ આવ્યો છે બીપી આવ્યું છે બરાબર એટલે
Sir, I once again request all the faculties, all the teachers, if you are not asking the question, please mute your mic. Please mute your mic if you are not asking the direct question.
Sir, I think we have to mute all
ICU
the
વગર એમાં એવું છે, જો બે વસ્તુ છે. એક તો આપણે ગમે એટલી ટ્રીટમેન્ટ કરીએ તો એનો બેઝિક રોગ છે જે મૂળ.
Hello.
Yes, sir, you are audible.
Yes, I have unmuted all. Please, those who want to ask the question, only unmute yourself. How can we differentiate between the problem-based learning and case-based learning? Has final year course curriculum clinical subject been prescribed integrated with the anatomy? Ma'am, are you here? Priti ma'am?
Yes, Joshi sir, yes. See, in
Yes.
problem-based learning and case-based learning, there is a slight difference between problem-based learning and case-based learning. Okay, mostly problem-based learning, you have you inculcate it as in it can be for all the situations. You can just involve all the clinical situations also. There is slight hairline difference between problem-based learning and clinical-based learning. Here, basically in problem-based learning, one more step is much important. That is, you have to go for the concept mapping, like identify the cues, and then you are going for searching the learning objectives. Okay, you go for searching the learning objectives over there, and then the presentations are being there. Okay, whereas in case-based learning, this whole procedure is that step approach or the 3 sessions, they need not to be conducted. So only there is a slight difference in between the sessions and all. But rest of the things like formulating a clinical scenario, that remains the same. Okay, that remains the same. Only the sessions and the students, they come up back, they present the things, and the problem-based learning can go on for many sessions. It can go for 4 weeks, like 1 hour or 2 hours per week you can go. But case-based learning, it is a shorter duration. It can have shorter duration. But important, it happens that case-based learning, it only the methodology differs here. Case-based learning, it will be a short duration process. It has to continue for all the 3 sessions. That is the major difference between problem-based learning and case. Okay, and I think this question was there, and next was, what was the next question, please?
I think we have lost that question. It's okay. Final year course curriculum. So
Okay,
next part was, has final year course curriculum clinical subject been prescribed integrated with anatomy? The syllabus is yet to be drafted. Syllabus is yet to be drafted,
Yes.
but it will be in the alignment, I hope.
Yes, because whenever it is for final year, when the final year projects are there in the previous, so anatomy being the basic sciences, you have to start. Basically, the integrated teaching starts from the basic department, that is anatomy and physiology. When we are practicing it, it starts the first lecture. When we plan the timetable, the first departments to present are anatomy and physiology, and then they go to the paramedical departments, and then the last presentations are of the clinical department. It will go in a hierarchical manner only, right from basic knowledge to the clinical applied aspect. Okay, so obviously the final year draft will be there in horizontal vertical teaching, anatomy and physiology departments will have to be there.
A very interesting question. How it is possible to teach 100 students in clinical class in the hospital, because already intern, final year and second year student already taking clinical demos. So I would like to answer this question.
Yes, sir, very interesting.
Yes, I would like to answer this
Yes,
question. It is all about the resource sharing. Okay, and the objective that we have. Priti ma'am? Priti ma'am?
Yeah, we can. Yes, sir. Yeah.
Go ahead.
Shall I continue, sir?
Yes,
Okay,
yes,
I'll
yes,
elaborate
continue.
on this because
Continue.
yes, this is an actual difficulty because see, when we will be into implementations of things, there'll be lots of obstacles coming our way because we have experienced this, and therefore what I told you that when I was going through the presentation that you have to communicate and align with the departments wherever you are going. For example, Chikitsa, Panchakarma. So when the interns, mostly the clinical postings are in the morning hours. So the schedule of hospital visits when I am doing my early clinical exposure, I mostly keep it from 3 to 4 sessions. And that is 3 o'clock to 4 o'clock session, or that will be where or 4 to 5. And because by 4 even the patients are done with their they have completed their rest period, and 4 to 5 is not a period when the interns they have completed their all their work, the clinical posting has been done, all their procedures are being completed. So that is a time post lunch you can just take the consult with the particular departments and you can manage at that particular period. And see, the early clinical exposure is a total early clinical exposure period. If we come to it, it's 18 hours. Okay, the 18 hours have to be split in the period of 18 months. And how we are going to do it? Again, that 100 students should not be taken. It will be a batch of 25 students when we take them to the hospital. So you have to take the like for example, if I'm telling them the case of Amvata. So in unit 1, I can have 25 students. In unit 2, I can have, there will be number of cases of Amvata or number of cases of a particular disease. We mostly take common diseases when we go for early clinical exposure, which the students are going to face in the real life situation. For Ayurveda students, when he's being a physician, आपके पास तो जाके ligament injury का case तो नहीं आएगा. So the common cases which are faced, we should be able to show them at least those cases. And these cases are available, so you can differ into that. A few students are taken into one unit, some are taken into another unit, or even you can just divide them into days. First 2 batches, you can just, it hardly takes 15 to 20 minutes, 25 minutes for the hospital visit. So you can just plan it in batches also, and the students can be in a smaller groups. That can be, and that can be accommodated.
Yes, and there can be many activities planned simultaneously. Like many activities. So it is not just one case for which we are taking students to clinics. So,
there is one another question, sir. Means there is a internal assessment and a viva OC marks will be added to theory, so that out of 300 we have to take the 150
अब तो
marks.
फिर वैसे भी स्ट्रेंथ बढ़ती जा रही स्टूडेंट्स की, धीरे-धीरे
Ma'am,
चेयर
please mute
बढ़ानी
yourself.
पड़ेगी.
ma'am, please mute yourself.
अपने यहाँ भी ना सर रेगुलर में भी जरूरत पड़ेगी. 75 आने लगे ना, पहले 30 आते थे.
Neetu
Okay, I have muted all. Those who want to unmute can unmute themselves and ask the question.
Sir, so I am going to just give information about that. No inter-assessment will be given to the theory. There is a pure only theory questions are there in the our summit examination. 100 and 100 means 200 questions, 200 marks for the theory paper. There is no inter-assessment. Internal assessment is added only in practical mark. So there is 50% compulsory passing in theory. There is not any support from the internal assessment to the students. This is from my side.
Okay, I was discussing the earlier question. So I will take that question again because there are many discussions with these questions. So first, there is something called as resources sharing, batch sharing, time sharing. So when we do these kind of concepts, when we act on these kind of concepts, so no more island effect for the subject, no more ekla chalo re policy. So no more one department doing whatever they are planning. We have to come together. There should be a common time. There should be a common objective because we have many things common. We have many integrative teaching approaches that we can adopt for the comprehensive teaching for one subject. Maybe the anatomy and rachana sharir and kriya sharir, they may come together for various occasions. Even you may notice I don't know whether you have visited and visited the Sanskrit syllabus. Can we just have reactions? Please raise hand. Have you visited the Sanskrit syllabus? Am I audible, sir?
Yes, sir.
So can I get hands raised? Go to reaction section and raise your hands. Show thumbs up. Have you gone through the Sanskrit syllabus? Okay, I can see 10 participants only raised hand. Okay, 17. So out of 400, 40 have replied yet, and they have gone through this syllabus. So this is so there is something to just narrate or explain, that these nirukti part which were there in you might have noticed the nirukti part is removed from your syllabus. It was in the must know part, but now suddenly it is removed, or it is given a nice to know, or must know is there, but no teaching hours are allowed or allotted. So many such points, they are covered in Sanskrit. So Sanskrit aspect, that means Sandhi, Samas, Nirukti, Vyutpatti, they are also included in Sanskrit syllabus. So probably you have to go for it. So you can take help of them. You can have these non-lecture activities together, Sandhi, Samas, and so student will also learn and enjoy. So there are opportunities to be with the other departments, plan with the other departments. And in the initial talk, I was explaining the concept of timetable. So how much time is required? So it is clear that whole batch should be there for the practical. So timetable is arranged for the whole batch. So one more point I want to clear, which was raised as a query. It's a number of hours. So it's a 500 hours that should be there, and amongst which 240, Gaurav sir, 240.
Yes, sir, 240. 240
hours for the practical. Okay. So remaining 80 hours for non-lecture activities within the classroom, we have to have a separate time for that. It may be the lecture or non-lecture activity, but we can conduct in the classroom, but there should be some specific timeline. Because when we plan some non-lecture activity, it is hardly possible to complete within, say, stipulated time of 5 minutes, 10 minutes, 30 minutes. We can have a more time. So discussions, seminars, workshops, if we are planning, we have to have this flexibility in the timetable, and it is actually need of the time to all departments should come together. They should have a common meeting, common planning, and then go ahead, and that way we can share the resources, share the time, and achieve in 305 days.
Joshi sir.
Yes.
Dr. Kulkarni.
Yes, sir.
Regarding the practical hours, just you say whole batch should be there. But
it is the expectation.
There is no not possible. It is not possible to conduct 100 students in one batch. For
sir, okay, sir, you can take a call based on the infrastructure. 2 practicals. So there will be 51 weeks. Okay, so your 2 hours of practical of 2 hours. So you only need student for 4 hours in a week. So okay, that way 200 is achieved. Target of 240 can be achieved with the help of say 4.5 practicals a week. Okay, so 2.5 practicals a week. So that means 5 hours a week practical. If you are going for 5 hours a week practical, your target of 240 is achieved. So right now we have 6 days. So as per the convenience, you can plan. As per the convenience, you can plan and increase or decrease the timing of the hours of that particular practical. So this is the concept of dynamic timetable. It is not a stationary timetable. So we are in the concept of stationary timetable. The timetable is fixed and that will remain constant. So actually, when we have a bits of puzzle like activities, we can plan. So even a Sanhita Adhyayan session requires 2 hours. So maybe you require 4.5, say 5 hours of practical, and each practical is minimum of 2 hours. So either you can go for 3 practicals in a week for full batch, or 6 practicals for appropriate structured batches. Okay, so that way it can be solved. So when we say 6, the calculation is very easy. The calculation of lecture, non-lecture, when we combine them, 4 lectures in a day and 2 hours of practical plus 1 activity. Considering this for 5 days or 4.5 days, 5.5 days or 6 days as per the availability of the college, it is possible. It is quite possible to cover it within the 305 days. And although for this batch, we are going to get more days, because academic calendar for this batch is already available. So as per this batch, we may get more than 51 weeks. But even considering the 51 weeks, we can achieve this target in 305 days. Only with the smart working together, we can give the more comprehensive learning experience to our students. I think no new or how much time minimum is for their theory class for all subjects. I think it is already explained that 1 hour theory class should be there. Lecture hours, 1 60-minute class. Can we have like demo timetable, daily routine? See, right now every college has a different way of even writing the timetable. Some say on the left hand side there is the allotment of lecture hours like 10 to 11, 11 to 20, and on the above horizontal column there is Monday, Tuesday, Wednesday. Some are using it in a completely different way. On the left hand side, Monday, Tuesday, Wednesday, and in the above column timetable. So we have our own ways to make the timetable and accordingly follow the timetable. So this liberty remains with the institute, that this concept of dynamism is explained. So based on that, you have your own way to manage the timetable and complete it, complete all the lecture hours, non-lecture hours, and practical hours by the end of the session or semester and appropriate. So 30% weightage is for first term, 40% weightage is for second term, and 30% again weightage is for third term. That is explained in MSc.
Yes, sir. I have a question.
Yes, sir.
In vertical integration, I have a doubt. Madam have explained earlier. Over that, I have a doubt now. So in vertical integration, in the subject of embryology, it has been mentioned that the process of germ layer formation will be integrated with the Prasuti and Stri Roga. And similarly, under the MARMA, the anatomical description, regional anatomy, study of regional anatomy, that is integrated with the Panchakarma. So how to integrate these topics? Can you put some insight in?
Priti ma'am, are you here?
Yeah, I am there. So for Karma Shariram, like we were talking about Panchakarma and even yeah, I'm there, sir. Hello.
Please go ahead, ma'am. Go ahead. Okay, we can hear you, ma'am. Go ahead.
Yeah. Okay. Like Marma Shariram is there, sir. We go for while doing the Agni Karma, we just ask the applicability. So this is related to clinical exposure. This is when it is related to clinical exposure. We need not combine it with clinical exposure. This question was earlier asked also. When I'm talking about the kind of integrated teaching, and these integrated teaching are, I think there's so 16 hours which I'm talking about. Yeah.
It's not.
Ma'am, your voice is breaking, ma'am. So we couldn't hear you.
Hello. Hello.
Ma'am, your voice is breaking.
Am I audible? My voice
Ma'am, voice
is
is breaking.
No slicer dicer की नहीं आई. हाँ.
Your voice is
Hello?
breaking, ma'am. Okay,
Still
we'll
it
go
is
back to
breaking.
the question. Gaurav sir, would you like to answer?
Yes, sir. As like ma'am said that it is not that integrated teaching that earlier said in the teaching learning methodology. Just we are going to be just conduct that we are going to just relate that clinical application means just that the marma therapy, that the adhikagni karma or other we have to point out these facts during the teaching while integration of that topic in the theory lectures. We can include this clinical conditions during the theory lecture. But if you want, or at the applied aspect, we can ask that teacher also to come in the class for only for the 5 minutes and elaborate that theory topics in the clinical ways, so that the student can inculcate that clinical condition. There we have to prohibit it or the murmur clinical application of murmur points in the clinical side also. So in that theory lecture, we can ask that clinical faculty for the few minutes to explain that clinical points also. Otherwise, if the clinical faculty is not available, we can teach students about that clinical aspect of the murmur points. So that is the concept of the integration of that department with the theory lectures and integrated teaching that earlier in the teaching learning method that Desai ma'am elaborate. This is another different concept for the integrated teaching. There are those two concepts, that integrated teaching and integration of that department with the theory lectures. Those are the two different methods.
Yes,
Hello?
thank you, Gaurav sir.
Yeah,
Can we
I
go
think,
back to the
it's clear.
question? I could see who have asked this question, sir.
Hello, Joshi sir.
Yes.
Dr. Joshi.
Yes, sir. Just coming to you, sir. Naresh, sir, I will come to you, Dr. Naresh. But before that, who has asked this question? Earlier question of integration.
So that was from JSAM, from JS
Yes.
Nadiyat College. It was from JS Nadiyat College.
JS Nadiyat College. Anybody here?
Yeah.
I think Dr. Swati is there.
I can see Dr. Swati Bedekar here. And Dr. Swati Bedekar, I can remember, she used to conduct these kind of sessions with surgery. So for the instruments, for even dissections, for even gynecology, some specimens, then some neonatal specimens, they used to come together and teach a lot during the college hours. Ma'am, you can share your experience with the sir, so that it will be more beneficial for all of us. Would you like to go ahead? Just in a minute.
So before that, I would also, sir, just a minute, I will interrupt. Madam has also developed a very nice museum in the department along with her team. And it is really, as I said, now allied institutes to be visited. So I would recommend to go to JS and visit the institute, anatomy museum especially. They have lots of innovations done there. Swati madam, you can continue.
Thank you so much. Yes.
So Swati madam, you can just share this with the team even afterwards, or you can just come up with a write-up or something, so that it can be circulated to everyone. So thank you. So Dr. Naresh, I'm coming back to you. Are you here, sir?
Yes, sir. जोशी सर, पहले तो मैं आपको बधाई दूंगा भाई आपकी टीम को.
वो सर NCSM है, चेयरमैन सर है, प्रेसिडेंट सर है, we are just the helping hands.
आपने बहुत अच्छा काम किया है. वेरी नाइस सर. हमारी नेक्स्ट जनरेशन जो है उसको एक गाइडलाइन दी है आपने, आप और देसाई मैडम, गौरव सर, बहुत ही अच्छा काम किया है.
सर इसमें और भी 10 लोग हैं. शर्मा सर थे कमेटी के चेयरमैन. यू कैन गो थ्रू द नेम्स सर. फिर हाँ 10 नाम है, वो सभी लोग, एवरीबडी हैज कंट्रीब्यूटेड.
जिन लोग आपकी टीम है बहुत अच्छा काम किया है. एप्रिसिएशन जितना किया जाए उतना कम है. थोड़ी सी बहुत अड़चन है सर, लेकिन हो जाएंगी दूर। थोड़ा सा इंफ्रास्ट्रक्चर में डेवलपमेंट करने के लिए बोलिए आप NCISM से, तो मुझे लगता है कि हम ये इम्प्लीमेंटेशन कर सकते हैं, बहुत अच्छे ढंग से कर सकते हैं सर।
सर अभी सर ने कहा, प्रेसिडेंट सर ने और चेयरमैन सर ने भी, आपको जो भी सजेशंस है यू कैन जस्ट राइट अप and you can directly send to President sir and Chairman sir. The mail IDs are already available on NCISM website.
जी जी, very nice sir. Highly appreciating your team and your work also. Highly appreciating.
It's our team, sir, our work, and we have to deliver. Thank you.
Thank you, sir. Thank you.
Dr. Joshi, sir.
Sir, one of the key members in the committee is asking the question. Sir, we want you to answer the question.
No. One point I wanted to discuss.
Yes.
Regarding body donation, anyhow, we are talking much about PO and CO.
Yes.
After completion of degree, the student should be able to do practice, based on the syllabus. And as you know that we have included syllabus related to body donation and preservation methods of the body.
Yes, sir.
The problem is that I am going through different anatomy acts. I have gone through Karnataka Anatomy Act, Maharashtra Bombay Anatomy Act, and Gujarat Anatomy Act.
Yes.
In all these acts, nowhere it is mentioned that the Ayurvedic anatomist can preserve the body and can accept the donated body. Nowhere. And now recently, I myself and our Dean, Dr. Hemant Shikhane, discussed this matter with even Prasad sir also. And now we have given a letter application to NCISM to throw a light on this, and even they can offer a right of preservation and accepting donated bodies to Ayurvedic colleges. And it will be very good. From my side, please convey this message to Prasad sir or President sir, and to include in the MSR and to legalize these all points.
Yes, sir. Sir, you have an equal approach and direct concern. Thank you for bringing out this point here. So you can just send it via mail to sir directly, sir. We will convey this. This meeting is recorded. We will convey, but you can directly send so that appropriate actions will be taken from the sir. Thank you.
Sir, why I raised this point on this platform, because there are three, now I am seeing 3790 anatomists on this platform now. And so that this message should go to all the anatomists, and in their state, they can start this movement.
Yes, sir. Yes, sir. Thank you for bringing this up. Thank you. It is noted, sir. Before I mute everybody off and we conclude this session, because there is one more session which will be starting soon. So,
routine
Dr. Joshi sir, can I ask a question?
yes, please. Those who are not asking question, can they please mute themselves?
Dr. Joshi sir, can I ask question?
Just a minute. I will mute all. You can unmute and ask the question.
Okay. Dr. Joshi sir.
Please ask the question, sir.
Dr. Joshi sir, can I ask question?
Yes, sir, sure.
Myself, Dr. Nilesh Pillai from College.
Last question, sir. Thank you.
My question is whether the concerned state university can modify blueprint of question papers. As we know, our curriculum has given that all questions are compulsory questions. This is the first question. And second, whether NCISM is going to modify topics and related lecture hours of certain topic like osteology. They have given 9 lecture hours for osteology, and they have mentioned that you have to describe all the bones, and related to osteology is description of bones. It is quite not possible to complete all osteology in 9 lectures.
Sir, I think first question you have asked is something that is out of purview of this particular meeting. So
Okay.
I will not take that question.
Okay.
Thank you for being considerate, because this is a different platform. This is just a narration or orientation of this curriculum. And the question you have asked is related to the boards, so universities. So probably we are not the individuals who can answer this.
Okay.
Even the second question, right now it is published. Okay, I would like to answer not for osteology, but for any topic, because this is something came out of the consensus of the 10 committee members when they discussed the how much time should be allotted to this. So probably based on their experience, the committee was a very good mix from the seniors as well as the postgraduate students. So it's a mix. Average of it is indicated there. You can record it for a year for the one batch, and if you find that this takes a lot of time, and some other topic may be there which can be covered in less time, you can make a note and then forward it. Actually, we want this research approach for further development whenever there will be a new improvement in this form of curriculum. So right now this is based on experience. Because we don't have any comparators, we don't have any fixed bars or parameters which are fixed that this can be covered in 1 hour, 2 hour, 3 hour. And of course, it depends on the teacher to teacher and method to method. Suppose you are adopting some method for this, it may take 1 or 2 lectures extra. But this is the flexibility that we have, and this is a broader outline. So you can just make a note of this and then report it to council. Thank you, sir.
Okay, thank you.
Sir?
I think we are exceeding time. It was 1 and now it's almost 1:40. We have to join back at 2:30 for the next session.
I want to ask only one question.
Okay, sir, go ahead.
Sir, it seems to be very difficult to teach with all lectures, non-lectures.
Sorry, we couldn't hear you, sir.
Yes?
We couldn't hear you, sir.
Sir, it is finding very difficult to fit all these lectures, non-lectures and practical in a timetable, sir. So, if you provide a model timetable, college-wise timings may be changed, but if you provide a model timetable, colleges can adjust time.
Sir, that is, sir, I think I have explained the concept of a dynamic timetable, which actually is required. This is the need of the time. So I will just end this meeting with one thing, that we are working in the college for say 6 hours or 8 hours. But we have many things. Right now, the teachers are busy in many things. So we are doing many things, and we are expert in time management. I think all the teachers, those who are working in all the colleges, they are expert in time management. So this shuffling, when everybody will come together and will discuss, this problem is very little and this can be easily overcome. Thank you.
Hello, sir.
Yes.
Sir, is it possible for the two people all this to complete all this curriculum? Is there any provision to about the staffing pattern, sir, in the upcoming days?
So this is again out of purview of this platform or meeting. You can write to council. Thank you.
Okay. Okay.
I think we should end this meeting. Thank you. Thank you all for being here. If you have any feedbacks, you can just post it. Kulkarni sir.
Yes, Doshi sir, thank you very much.
Thank you. Thank you all. And thank you all the team, and thank you for the patient listening. I can see almost 250 participants till now.
Thank you very much.
Thank you.
Thank you.
Thank you.
Thank you. Thank you. Thank you.
Thank you, sir.
Thank you very much.
Thank you all, sir. Now we are going to end this meeting. Thank you so much.
Thank you.
Thank you very so much.
Recording stopped.